Sri Siddheshwar Women's College of Engineering, Solapur. I extend a warm welcome for the inaugural function. I heartily welcome today's chief guest, Dr. N.N. Malda sir, former Vice Chancellor of 𝐻𝐻 𝐴HILYADEVI Jeurkar, Solapur University. Our principal and convener of this FDP, Dr. T.H. Chavan sir. FDP coordinator, Dr. Avinash Patil sir. Co-coordinator, Dr. Santosh Madki sir, and all the participants from different esteemed institutes. The objective of AICTE's Training and Learning Academy is to impart quality training through the Faculty Development Program. In a way, we are going to explore the world of advanced materials which are transforming various industries from energy to healthcare. We are having an eminent speakers who will share their expertise on the latest advancements in material science and their applications. Now, I would like to call our respected principal sir and convener of this FDP, Dr. T.H. Chavan sir, for his speech. Over to you, sir.
Okay, thank you, Nimbani madam, and good morning to all. The chief guest for today's inauguration function of ATAL FDP on advanced materials, a paradigm shift in and Honorable Dr. N. Chancellor, Solapur University, Solapur. Dr. A.S. Patil, HOD, Head of the First Engineering Department and Coordinator of today's ATAL FDP, Dr. 𝐿𝐴 Assistant Professor and Co-Coordinator of this ATAL FDP, all the staff members and all participants from various colleges all over India. On behalf of our college, Sri Siddheshwar Women's Engineering College, I, Dr. T.H. Chavan, Principal, welcomes to our chief guest, Dr. N.N. Malda sir, former Vice Chancellor of Solapur University, Solapur, for accepting our invitation as a chief guest for today's inaugural function of ATAL FDP on advanced materials. My special thanks to all participants for participating in this national level ATAL FDP. Also, my special thanks to AICTE for granting our ATAL FDP on advanced materials, a paradigm shift in modern technologies. Today, we all have gathered here to inaugurate our ATAL FDP on advanced material, a paradigm shift in modern technologies, which will be starting from today and will continue for 6 days up to Saturday. The purpose of ATAL FDP on advanced materials is a paradigm shift in modern technology is to know emerging trends in advanced materials and modern technology in the field of engineering, and also it will motivate the faculty to achieve holistic approach and competitive teaching learning skills among them. It plays a crucial role in enhancing the skills and expertise of teachers, faculty members, ultimately enhancing the skills of the faculty and improving the quality of education. Our all resource.
Hello, sir. Sir, unmute please. Unmute please. Chavan sir. So your mic is muted, sir.
Yes. So now is it audible, sir? Hello.
Yes,
hello?
sir. Yes, sir. Audible.
Okay.
Yes, sir. Audible. It is audible.
Okay. Okay. Shall I continue next?
Yes,
or?
sir. Yes, sir.
Yes, sir.
Yes, sir. Continue next, sir. Next, sir. Earlier, all is over.
Okay. Okay. So my request to all participants to attend this session today. This FDP, definitely will get insights in this. Now for the information, I would like to put few things about our college. Our college, Sri Siddheshwar Women's Engineering College, Solapur, is started in 2019. Under the the aim of the trust is to provide quality education without commercialization. Initially, when the college started in 2019-20, there were only 28 students in the college, and now there are 1,500 students in the college. The college has highly qualified, experienced, and dedicated faculty members. Our college faculty faculty follows a unique engineering teaching learning pedagogy known as ETLP, which focuses more on the learning of students, because of which we are getting excellent academic and placement results. Our college is providing training on soft skill, aptitude, technical skills from external agency and in-house to enhance the employability of skills of students. As a result of these efforts, our 2 batches placement was more than 85% in renowned multinational companies like IBM, TCS, Cognizant, Capgemini, Persistent, Accenture, Deloitte, CGI, LHP, Hitachi Energy, etc. So one of our first batch student, Miss Saili Navgire from CSC department, selected in Indian Air Force as a technical commander with 23 lakhs package. One of our student, Miss Srushti Sete, stood third with bronze medal in highboard diving at Southwest Zone National Aquatic Championship held at Chennai and has been selected for All India Aquatic Championship. Also, Miss Shravani Chakote won silver medal in university level Aviskar project competition in this year. Our 6 students of ENTC have participated in Smart India Hackathon organized at Panipat, Haryana on 12th December 24. So today we have gathered here and for the inauguration of this FDP, and we are very lucky to have a very renowned, highly qualified and experienced speaker, Honorable Dr. N.N. Maldar sir, former VC of Solapur University, Solapur, as a chief guest for today's inaugural function on FDP, that is Advanced Materials, a paradigm shift in modern technology. So I'm sure that by attending this FDP, you will be definitely enriched with new insights in emerging trends in advanced materials and modern technologies in the field of engineering. So once again, I welcome all the participants and chief guest, Dr. Maldar sir. And with this, I conclude my speech and I wish you all the best for these all 6 days, and definitely you will come to know you will be enriched with the paradigm of this advanced materials, which is part of science and also engineering. So this in the engineering, how this science that is technology or science knowledge we can utilize for our teaching. So with this, I conclude my speech. Thank you very much.
Thank you, sir. Your words always motivates us to do the best things. Today, we are privileged to have Honorable Professor Dr. N.N. Maldar sir for this inaugural function. I would like to call our head of the department and coordinator of this FDP, Dr. Avinash Patil sir, for the introduction of Dr. N.N. Maldar sir. Over to you, sir.
Thank you, madam. It's my great pleasure to introduce Professor Dr. N.N. Maldar sir. If I introduce sir thoroughly, then it will take hours, as he has vast experience of more than 40 years. So I will introduce highlighted points about sir. So first of all, I welcome Professor Dr. N.N. Maldar sir as a chief guest of today's inaugural function of the 6-day FDP. Professor Dr. N.N. Maldar sir was former Vice Chancellor of 𝐻𝐿𝐴 Devi Jeurkar, Solapur University, Solapur. He has worked as a Vice Chancellor during 11 December 2012 to 10 December 2017. He has completed his PhD in polymer chemistry at National Chemical Laboratory, Pune in 1981. He received postdoctoral fellow through NCL Pune and postdoctoral fellow with scholarship, special scholarship from Government of Japan, Tokyo Institute of Technology, Yokohama, Tokyo, Japan. He has also received postdoctoral research fellowship from Southern Methodist University, Dallas, Texas, USA, and University of Arizona, Tucson, Arizona, USA. He knows Japanese language very well. He received College Merit Scholarship, National Merit Scholarship, Junior Research, Senior Research, Postdoctoral Fellowship. He has worked as a visiting professor at Hanyang University, Seoul, Republic of Korea. He has received Best Teacher Award from Rotary Club Solapur, Adarsh Shikshak Puraskar, Lions Club Solapur, Bharat Jyoti Award from New Delhi. He has received Lokmat National Education Leadership Award, Special Educational Seva Gaurav Award 2015 from Avishkar Social and Educational Foundation, Kolhapur. He has been awarded as a 100 most influential Vice Chancellor in 2016 from World Education Congress, Mumbai. He has held many administrative and academic responsibilities. He was a scientist at National Chemical Laboratory, Pune. He worked in Solapur University with various capacities as a HOD of Department of Chemistry, Director of School of Chemical Sciences, Director of BCUD, Acting Vice Chancellor. He has a vast experience of research, more than 43 years of research experience. He has published more than 175 research papers. He has guided 20 research PhD students, 6 MPhil students. Number of research projects completed from BRNS, DST, UGC, ISRO. He has attended various international conferences at Japan, USA, South Korea, Italy, Finland, Turkey, etc. His main research area is synthetic polymer chemistry, high performance polymers, organic chemistry, spectroscopy, renewable resources, carbon nanomaterials, medicinal natural products, organic and hybrid solar cells, fuel cells, desalination membrane, drug delivery system, etc. He has worked as a peer reviewer or referee for various international scientific journals. He is a member of more than 20 Indian or foreign prestigious professional bodies. His major achievements during his tenure of Vice Chancellor. During his tenure, university has received 12B status. Under 7th 5-year plan, university has received 7 crore grants, NAC B grade with CGPA 2.62. Recently, he is working on various fee fixation committees of various universities as a chairman, as a member. So many more to tell about him. So due to the time constraint, I restrict here itself, and I feel we are all very lucky to have such a towering personality as a chief guest of this inaugural function. Thank you very much, sir, and thank you once again for inviting or accepting our invitation. Thank you, sir. Over to Ashwini, madam.
Thank you, sir. It's now a time to hear from today's chief guest. It's my pleasure to invite Dr. N.N. Maldar, sir, for inaugural speech. Over to you, sir. Maldar, sir.
Maldar, sir.
Yes, please. Yes, please.
Yes, sir.
Thank you, sir.
Good evening, all. Thank you, Dr. Avinash Patil, for your kind introduction. And also, I would like to thank Honorable Patron, the President of the Sri Siddheshwar Devasthan Trust, Sri Dharmaraji Kadadi, for kindly inviting us. Respected convener of the today's event, the principal of the Sri Siddheshwar Women's College of Engineering, Dr. T.A. Chavan, sir, and coordinator Dr. A.S. Patil, co-coordinator Dr. S.J. Madgi, and the members of the organizing committee, distinguished resource persons, and dear delegate participants attending this event. Namaskar and warm greetings to all of you for the new year 2025 and Makar Sankranti. Indeed, it's my really honor to be with you today on the occasion of this 6-day online ATAL Faculty Development Program on the Advanced Materials, organized by the Sri Siddheshwar Women's College of Engineering, Solapur, a place of learning named after Sri Shivayogi Siddheshwar. I extend my heartfelt greetings and sincere gratitude to the convener, Dr. Chavan sir, whose unwavering commitment to the academic excellence and the students' welfare has been a source of inspiration for all in Solapur and in Maharashtra. I want to put on record my special appreciation for the tireless efforts and invaluable contributions of the coordinator and the organizing committee members. I welcome all the delegate participants. Now I can see on the screen there are more than 120 participants who have already joined. It's really great work done. I'm sure that with your hard work, determination, and perseverance on completion of this National Faculty Development Program, you'll be building a successful career. Many congratulations are due to Sri Siddheshwar Women's College of Engineering for arranging this important online FDP. Dear participants, I believe most of you must be the resident of the cities, towns, and villages located in the Maharashtra and other states in India. Indeed, I must say that you are privileged to have registered for this FDP while working to provide high quality technical education and skilling to the aspiring students. There are many initiatives of this national FDP which are noteworthy. I am very delighted to know that topics namely material science, polymeric materials, nanostructure, nanoscience, nanotechnology, medical materials, biotechnology, modern technology, fibers materials, composites, metals, and smart materials, etc., along with energy and sustainability, with skilling and entrepreneurship development, etc., are to be covered over the next 6 days of the FDP training. This is in tune with the new education policy to improve the quality of the technical education system in the country. Dear participants, as you prepare to attend this 6 days online faculty development program, it will be the next chapter of your academic journey. This FDP will provide you advanced knowledge, skills, and values. As you reflect on your time spent in this wonderful FDP, I urge you to cherish the memories, the friendships, and the invaluable lessons learned. During next 6 days, you are likely to learn a change, innovation, and progress through how to understand, analyze, and solve complex, deeply connected problems, both at global and local level. You will have to be the agent of this change. You will learn that complex problems facing today's world cannot be solved by the lone individual. They require exceptional network of the team spanning across the multiple institutes and many disciplines. Lectures by the eminent, renowned college and university academicians, industrial scientists, senior consultants, research professors from abroad like South Korea and Saudi Arabia as research persons may guide you about how to acquire the power of intellect and the spirit of innovation. The lessons learned with this National Faculty Development Program and the guidance received from the resource persons may enhance your integrity, your commitment to the excellence. It may create the power of self-belief. Once again, I congratulate on your participation and may your 6 day ahead be filled with boundless discussions and endless lessons. Finally, I declare this 6 day online mode ATAL National Faculty Development Program on advanced materials is inaugurated and open for further learning. Thank you.
Thank you very much, sir, for your inspiring words and invaluable insights.
Thank you, ma'am.
Thank you, sir. Now we will come to the end of this inaugural function. On behalf of Sri Siddheshwar Women's College of Engineering, I would like to extend my gratitude to our today's chief guest, Dr. N.N. Maldar sir, our principal, Dr. T.H. Chavan sir, FDP coordinator, Dr. Avinash Patil sir, and co-coordinator, Dr. Santosh Matki sir, and all the participants from different institutes. Thank you once again. I request all the participants to stay tuned for the first session. We will start our first session within a minute. I request all the participants to stay tuned in the meeting.
Thank you, Maldar sir.
Maldar sir.
Maldar sir.
Hello sir. Hello sir.
सर बहुतेक हे केले असतील.
नाही आहेत
ना. Okay.
But his mic is mute.
Okay.
I once again request all the participants to stay tuned. I would like to request all the participants to join with your name as you registered.
Maldar sir, shall we continue with the first session?
Yes sir.
Shall we start, sir?
Yes, 1 minute, Maldar sir. I will contact with Maldar sir.
Okay, fine, sir.
If you want to speak something again.
Hello.
Hello, sir.
I hope every participant is in the meeting. I once again request all the participants to join with your registered name.
Okay, out of coverage area. Also make number at transistor. The clap आवाज आला असतं बरं झालं. Hello, Nimmane madam.
Yes, sir.
Continue. Now, Jeurkar sir will start his first session.
Okay. Whether he has joined, sir?
Yes. Jeurkar sir, are you there?
Okay, fine.
Yes, I'm ready.
Sir, yes, sir. Let us just once we will check the PPT whether it will run or not.
Okay, I'll just share.
Yes,
please
sir.
check.
You please.
Okay. I hope every participant is in the meeting. Let's start with the first session. For this, we are having an eminent personality as an expert. I'm honored to introduce today's expert, Professor Shekhar Jeurkar sir, an academician and professional with a wonderful combination of industrial, teaching and consultancy experience. Professor Jeurkar sir holds bachelor's degree in metallurgy from Government College of Engineering, Pune, a DBM from Bharati Vidyapeeth's Institute of Management, Solapur, and M.Tech in Production Engineering from 𝐻𝐚𝐥𝐻𝐿 College of Engineering, Sangli. He has also completed a diploma in non-destructive testing from Government College of Engineering, Pune. Professor Jeurkar has a commendable 6 years of industrial experience with reputed companies like KSB Pumps Limited, Pune, and Shivaji Works Limited, Solapur. He transitioned into academia with an impressive 30 years of teaching experience in heat treatments and foundry defect analysis. A warm welcome to you, sir. So without further ado, let's dive right into the journey of learning. I would like to invite Professor Jeurkar sir for his session. Over to you, sir.
Thank you, madam.
Sir, please share the screen.
Yes, yes. Yes, is it visible? Yes, can you see the PPT?
Yes, yes.
Yes, sir, visible.
Okay, okay. Yes, so good evening to everybody present on this online mode. Before starting my lecture, now let me first thank to the university, the management of Siddheshwara Women College, principal, vice principal, dean, all HODs, faculties, the coordinator of this particular course, and the participants who are willing to study a very important aspect of our life, that is composite materials in medical application. Now, before starting my entire lecture, now let me first make a preamble and give you some insight of this particular topic. Why this particular part? Number one, nowadays we are having a particular discipline as an interdiscipline. It is not a pure engineering or science subject, but nowadays it is a mixture of science, engineering subject, and for last 30 years, not only engineering and science, but it is medical field also. Because nowadays the life of a human being is increasing, and an average life as per the statistical data has reached up to 67 years. In short, an average Indian person can live without any problem for 67 years as a statistical data. But as we are nowadays conscious about health, so in the older days, a particular deformity or a disease or some abnormality was carried out throughout the life. But nowadays, because of the advancement in engineering, sciences, as well as medical field, now we are having the replacement of different parts of our body, that is the organs as well as the bones, implants, and so on. In short, nowadays we are making certain repairs, as well as nowadays we are having certain replacements of human body. And what are the different materials which are making this possible are called as the biomaterials. Now, under our title of material science, we are having different materials, out of which nowadays one additional part is included, that is biomaterials. So in the older days, it was say metallic materials, ceramic materials, plastic materials, then composite materials. But nowadays we are having biomaterials. Now these biomaterials are making our life very comfortable as compared to the older days where man has to carry his disease or some problem, or after accident if he something is broken, he has to carry throughout his life. But nowadays we are having this facility because of this very important material group, that is they are called as the biomaterials, in which specifically I am dealing today with the composite materials in medical application. My topic is dealing with the fundamentals, make you aware about this very important group of material, and then later on you will find that the further details will be carried out by some other speakers. Okay, so with this preamble, I am starting with composite materials in medical application. The first part is about this slide. What is material science and engineering? Now we should know where we stand exactly and why we are studying this particular subject. So material science is a very common term which we have defined as material science and engineering is an interdisciplinary field concerned with inventing new materials and improving previously known materials by developing a deeper understanding of the relationship is mentioned there: microstructure, composition, synthesis, and processing of that particular material. So this is a combination of microstructure, composition, synthesis, and processing. So on the right hand side, you can see one more box where the first part was metals and alloys, then ceramics, then polymers, then composite materials are the latest addition, then semiconductors specifically for our electronic industry, and now the latest additions are the biomaterials. So in engineering materials, we are having these 6 different parts or the 6 different branches, you can say, which comes into picture for designing, developing different types of medical applications. Now, generally, the medical applications are of 2 different kinds. So they are specifying this with a typical name, that is medical hardware. So we'll go into the detail of that particular part. So the next slide says that what are medical applications? Generally, the word is medical hardware. Now, what are medical hardware? The definition is that medical hardware consists of any physical product that is used for medical purpose in patient, such as diagnosis, therapy, or surgery. Medical hardware devices includes a broad range of products, including, now these are the parts which we come to our day-to-day life. If you visit any clinic or any hospital or anywhere the healthcare is taken care of, including tongue depressors. In the older days, you must have seen our family doctor used to have this tongue depressor as a common tool. Then thermometers, blood sugar meters, artificial heart, then stents, then sonogram machines, then X-ray machines, stethoscope, and wheelchair. Now, why I have listed this particular part? That means this is the scope of this particular subject as an application part. That means these biomaterials or the composite materials are applicable to variety of parts, which are static part, dynamic part, implants, then surgical parts, and so on. So they are listed here as the films, scaffolds, fleeces, then composite, dispersion, sponges, sheets, tubes, membranes, injectable solutions, and so on. So these are generally called as medical application. Now see, I'm just making you aware that what is this particular type of field. Now here we are trying to combine the engineering field, then the science field with the application in medical applications or the medical field. That's why this particular type of part is in front of you. Now this is the what you can say the heart of this particular lecture. Now this is a short view of an ICU or patient care unit, which is mentioned here or which is shown here. Now you can see that this is the bed where the patient is lying, and around him there are number of such products, services, then pipelines, tubings, cylinders, then electrical wirings, then artificial components, and so on. Now these particular things, so this is the scope of this particular subject, that is biomaterials, where we can have applications in all these things, taking into account that nothing is hampering to the disease of a patient without hampering his life, without making any allergy or anything to him, but it is solving his problem, making him good health. So this generally, out of this, I will just read types of medical devices include single-use devices, that is syringes and catheters. Now these are used and they are thrown away. Implantable, that is hip prosthesis, pacemaker, this fits in your body. Then imaging, that is these are the techniques for analysis, finding out the problems of a human body, ultrasound and CT scanner. Then there are medical equipments, that is anesthesia machines, patient monitors, hemodialysis machines, and so on. Now this category tells us that actually a product fits where. Now single-use devices are external devices, implantable are inside your body, imaging are the observation technique, they don't take part in this particular system, they give you the diagnosis. Then medical equipments are the supporting part, generally they are giving you the or they supply you the required system, that is anesthesia machine or say heart lung machine and so on. So all these are the classification. Now this classification is important to know that which material is suitable where. So here you can see all these details. So I'll just start with this particular one, as it will take some time, but it is necessary for the further part. Now this particular system, this is a biomaterial where the patient is lying, say for example, starting from 1 day to say months together. Now this is a cushioning. Now try to understand that a body is in contact with this particular material for number of days, with that patient having secretion of his body fluids, then some operations, then bandages, blood, and so on. Now this material should not get reacted with that. The second point, important point, is that this material should not allow the organisms, bacteria, then algae, then viruses, and so on, so that this remains inert throughout that stay of that particular patient. So this is cushioning. Then you can see a artificial leg, generally the medical prosthesis. Then there are adhesives which are used for bandages, then fitting certain parts on the body, fixing certain medical equipments. Then encapsulation for electronic components, that if there is a monitor, then it should have certain encapsulation. It should not it should avoid the growth of the algae, that bacteria or microorganisms, and so on. Then external coatings for electronic products. Then there may be syringe coatings. Then there may be inside coating for glass containers for medicines and injectables. Then there are cleaning fluids for electronic products. Then there are tubings. It may be plastic tubing, it may be metallic tubing. Then there may be dry skin adhesives for medical prosthesis, then ECG contacts, EEG loads, and so on. Then there are coatings in electronic circuits. Then in inhalation mask and inhalation balloons. Then we're having electronic based medical equipments, then insulator coatings, then CT and MRI machines. Now, unfortunately, there was a COVID situation in which we have suffered a lot. And at that time, you must have heard that because of, say, masks, because of certain reusing of certain equipments or the tubes or certain inhalers, there were a lot of complications in the COVID situation. Now, that particular part is extremely important because the system should have the required hygiene, then biocompatibility, and it should not promote any other disease than the patient is for cure. So the doctor is acting on one particular disease, and all these materials, which are the artificial materials, should not generate any complication for this particular main lying of that particular patient for a sufficient length of time. Now that's why this particular system is required. So as we are taking care of all these things in hospitals, now knowingly or unknowingly, even this is one important information to you, that if you know all these details, definitely we'll try not to meet any person in IC unit, because our presence, because of our body fluid, because of our sweat, because of our clothing, because of our shoes, spectacles, watches, mobiles, there should not be any development of any culture or any organism. So after knowing this, at least the first lesson that if these are the artificial materials, then we should take care that we should not add into the system. We should not add into the system any disaster part or any diseases. That's why after knowing this, at least you'll find that what is the importance of not meeting a patient inside an ICU unit. Okay. So now the next part, now classification of medical hardware devices. Now already we have considered, but now the classification is with some another aspect. Diagnostic devices, glucose meter, MRI scanner, ECG, sonography machines. Then therapeutic devices, these are bandages, inhaler, dialysis, ventilators. Then monitoring devices, BP meter, oximeter, surgical instruments, scalpels and forceps. Then implant as the coronary stent, then the dental implants, artificial heart valves, and so on. Means what? Whenever we try to manufacture any material, now it is our first duty to find out where it fits. What are the requirements? Because the requirements of diagnostic devices may be different from surgical instrument. So that particular property requirement is important, and that is to be understood is clearly before starting this. Okay. Now I'm coming to the material part. Now this was the preamble for the information about the medical field. Now we'll come to the material science part. So I'm going to give you the fundamentals so that it will be clear for you to understand the next lectures also. So what are materials? The substance or substances naturally occurring of which a thing is made or composed. It's generally defined as the materials. What are advanced material? This is the title of our seminar or this particular FDP. So we should know what are advanced materials. It refers to all new materials and modification to existing material to obtain superior performance in one or more characteristics that are critical for the application under consideration. So advanced materials are like this. It is the modification in the existing material. So what are composite materials? Now my topic is composite material. So I'm trying to define this. Composite material is a material composed of two or more distinct phases, matrix and dispersed phase, and having bulk properties significantly different from those of any of the constituents. Means you are getting third set of properties, neither from matrix nor from dispersed phase. So you are getting some advantages of composite material. So what is matrix phase? The primary phase, which is generally in excess, having a continuous character, is called matrix. Matrix is usually more ductile and less hard phase. It holds the dispersed phases and shares a load with it. Now, what are dispersed or the reinforcement phase? The second phase or a phases is embedded in the matrix in a discontinuous form. This secondary phase is called dispersed phase. Dispersed phase is usually stronger and the material for the reinforcement of that particular phases. Okay. Now the third one, the most important point, why? Why to study composite material? Why to study composite materials or composite biomaterials? So the question starts, if we know properties required for a medical hardware, now with this knowledge, select a proper composite for it. That is, this is called as the material selection. If we want to manufacture a healthcare product for medical hardware, select a proper manufacturing process for it. That is manufacturing process selection. Third one, if we want to maintain or repair a healthcare product for medical hardware, select a proper maintenance process for it. It is generally called as maintenance process selection. If we want to abandon or scrap or waste healthcare product for medical hardware, select a proper disposal process for it. Generally, this is called as medical waste management. So nowadays, we are having a very critical problem with this medical waste management, because we are having in our house lot many plastics, lot many composite materials. After usage, their disposal is very problematic, because the waste management system, which from our house, they are not collecting this particular medical waste, syringes, or say for example some healthcare other products, then the tubes, medical tubes, then the strips which are for medicines and so on. So that is the medical waste management. So this particular is the part why we have to study composite material with this aspect: material selection, manufacturing process for selection, and manufacturing process for maintenance, and lastly medical waste management. Okay, now we'll come to the next part, that is the composite. So we'll go into the further detail of composite. What are composite material? A composite material can be defined as the combination of matrix and reinforcement, which when combined gives properties superior to the properties of individual components. In the case of composite, the reinforcement is the fiber and is used to fortify the matrix in terms of strength and stiffness. So generally, whenever you add any reinforcement material in the matrix, the first effect is increase in the strength and stiffness. The reinforcement fibers can be cut, aligned, placed in different ways to affect the properties of the resulting composite. The matrix, normally a form of resin, keeps the reinforcement in the desired orientation. Now this is specifically for plastic or resinous material, because in medical field we are having a very large component manufacturing, starting from our saline tube to the stent, which are falling in the composites, which are polymer matrix composites. That's why this particular 2 or 3 sentences appear here, and it bonds the reinforcement so that the applied loads can be effectively transferred. Okay, so what are the matrix materials? The matrix material, that means the base material, may be polymer, metal, ceramic, and glasses, and the carbon. The carbon, nowadays we are adding carbon also. So in polymers, we are having thermosets like epoxy, phenolic resins, and unsaturated polymers. Then thermoplastics like nylon, PEK, that is polyether ketone. Then PPS, that is polyphenylene sulfide. Then metals, aluminum, titanium, magnesium, nickel, and cobalt. Then ceramic and glasses like silicon carbide, nitride, silicon nitride, Al2O3, alumina. Carbon as carbon and graphite. Then reinforcement, that is reinforcement in this particular form, can be added into matrix as per our requirement. Fibers may be polymers, metal, ceramics, glass, and carbon. Whiskers may be crystals and whiskers of copper, iron, silicon carbide, Al2O3. Particulate matter, these are shapes like square, triangles, round shape. In next slides, you will find some details about all these things. So now we come to the next part, that is, what is the classification of composite material? Now this is a general classification. It is of 2 categories. One is based upon the matrix and second is based upon the reinforcement. If the composite material classification is required, so we can have ceramic metal composite, polymer matrix composite, and metal matrix composite. In polymer matrix, thermoplastic and thermoresin, thermoset. Then composite material based upon reinforcement, it may be fiber reinforced, then particulate and structural, and thermoplastic matrix, then laminated matrix, then I'm sorry, I'm not getting this particular part. Okay, so you can just read that particular part later on. I'm sorry. So this is the second part. Then the third will be metal matrix composites. Metal matrix composites may be of matrix and reinforcement. So I'm starting the first category, that is MMC, metal matrix composite. Now in metal matrix composite, as the name suggests, basically it is made up of metals and alloys. Matrix will be always metals and alloys, while the reinforcement may be something else. But the resultant part will be having the properties of alloys. That means in metal matrix composite, you will get the properties closely related with metals and alloys, with certain specific enhancement in the property. So the matrix may be aluminum, magnesium, iron, and copper. Now why these 4? Why not others? So these are the systems where the body accepts these particular materials on a lighter scale. Now here we can have the other materials also, but commonly used matrix will be aluminum, magnesium, iron, and copper, in which we can have reinforcement of 2 categories, organic and inorganic. Organic may be red mud and fly ash, which is obtained after burning of coal, and inorganic materials will be oxides, nitrides, carbides, borates, and others. Now the resultant properties of all these particular metal matrix composite are nearing to the metals, but they are different than pure metals or pure alloys. That means the alloys. So what are these? So for this, we generally have this particular type of classification as well as information matrix. So MMCs, in matrix we are having 2 categories. Materials will be metals like aluminum, copper, magnesium, titanium, and so on. and the alloys of all these things. So that will be the second part. So we can have different alloys. Now, what is the function of a matrix or a role of a matrix? Now, try to understand this as a general function for other materials also, except their specific properties, to bind the reinforcement together and act as a medium through which externally applied load is distributed. Second role is to protect the reinforcement from mechanical abrasion and chemical reaction with environment. The third role will be to prevent propagation of crack from single fiber to other fibers. Next, to hold the reinforcement, creating desired shape of composite. Next is to keep the reinforcing fiber in proper orientation for high strength development, and to act as shielding from damage due to the handling. Now, this particular is the role of a matrix in general. So I am just listing this under the metal matrix composite. Now we'll come to the application part, because my lecture is having the title as the applications of different composite material. So I'm starting with the metallic biomaterial, in which specifically I'm starting with titanium alloys. Now, why titanium alloys? Because till date, the titanium alloys are the alloys which are suitable for biomaterials, and till date, we'll find that around 80% of the biomedical applications, starting from the hardware to the implants, is manufactured from titanium alloys. The manufacturing techniques, if you are an engineering student, then you will be knowing that we are having manufacturing techniques like foundry technique, we are having investment casting manufacturing technique, then forging techniques, then there will be machining techniques, which uses different kinds of machine, that is conventional and CNC machine. So this material is mostly suitable for our body till date. No doubt there is some advanced materials nowadays, but till date, looking into the cost of that particular component, generally titanium alloys is holding around 80% of the share of different parts in our body. So you can have this particular one. If I start with the skull of a person, and if I go from clockwise, the first is in our jaws, that is the dental implants. So this is CPTI. CPTI stands for the titanium matrix, commercially pure titanium. Then titanium 6Al4V. This stands for titanium as the base, 6% aluminum, 4% vanadium. Likewise, it reads in all the things. Now, dental implants, which is having the applications like this. Now, majority of you, or unfortunately, has gone through this dental surgery. Then you must have seen that there are different type of teeth. It may be metallic, it may be ceramic, or it may be even other materials, also low-cost materials. But the seat is generally this particular titanium. That means the implant or the base or the seat which fits into the bone of your jaw is generally titanium. Now this titanium screw is fitted, and this particular artificial teeth is prepared as per your shape and profile, and this system is generally called as the dental implant. Then if you go to the next part, that is the shoulder. Now shoulder joint, generally the people who do or who perform a very heavy body work, then unfortunately in accidents, many times this particular shoulder joint get failed. So we can have this particular white colored shining part, the shoulder joint, which is made up of this particular titanium alloy. Then if you come to the back side, this is a spinal cord. Now where we are having spinal spacer. Now spinal spacers are like this, that is titanium 6, aluminum, and 4 vanadium. Now whenever there is a accident or some breakage in this particular spinal system, or in a disease like spondylitis, that 2 spine elements has to be taken away, because when they come in contact, compression, then the nerves in between this get compressed. There is less blood supplied to your brain, and you start finding fainting. That means you have a feel of a fainting. So for this, these 2 elements, that is the spine elements, are tensioned, or they are taken apart with the help of spinal spacer. Now these spinal spacers are just mechanical, just like mechanical nuts and bolts. They are manufactured from this titanium alloys. Then this is the next part, that is the knee joint. They're very common nowadays because of the uh, arthritis and other things. Now this particular part, knee joint get damaged because of the walking or because of the overweight specifically. This particular type of knee joint can be replaced with the help of titanium alloys. Then hip joint and femur. This is the hip joint and the long bone which is in our leg. If it is a broken part, now generally, unfortunately, in women, this particular hip joint failure is a very common thing. Then in case of arthritis, this long femur, long bone, that is a femur, as well as this particular joint is getting affected. Then elbow joint, which is in our hand, the same part. Then orthodontic wires and inlays, crown bridges, then clasp, denture base. So inlays are the adhesives, then claps are the firm grasping part which are required for fitting. So all these particular parts generally are manufactured from this titanium alloys. So this titanium alloys are having this particular type of system which you can just see here, that for majority of our components which are commonly observed, till date 80% of the replacement is done with the help of titanium alloys. So due to the excellent mechanical, tribological properties, corrosion resistance, biocompatibility and antibacterial properties of titanium, it is getting much attention as a biomaterial for implants. Furthermore, titanium promotes integration without any additional adhesives by physical bonding with the living bone at the implant site. Now, these properties are crucial for producing high strength metallic alloys for biomaterial application. I'll just give you some additional information about this. Now, generally, wherever an additional component comes into this particular system, if you want to talk with this spinal cord, so you'll find that a body initially do not accept any foreign material in our case. But the titanium is so much biocompatible that whenever you fit this, the bones start developing on that particular part, that is the metallic part, and finally it becomes an integral part of your body. And the life of this particular titanium alloy start ranging from the 15 to 25 years. In short, if a person having this particular operation at the age of say 55, then he is very much comfortable up to his age of 70 to 75 without any problem. So the doctors do not advise all these things in the older age persons, but for a younger age person, you will find that this particular or middle age person, this particular systems works very well. So this is the biocompatibility and the life of that particular implant which is in our body. So these materials are so much competent that they replace your own body organs and the components, and they work at least for 15 to 25 years. Now, after 15 to 25 years, what has to be done? That is the decision of a doctor, because your body react on it, it becomes an integral part. So the major operation has to be carried out for replacing that particular system. So it depends upon your age, then it depends upon how you can bear that particular system. Okay. Now I'll come to the next part. It is called as the polymer matrix composite. Now, polymer matrix composite is a material consisting of composite made by adding fibers or particles to it. Polymers. Now, polymers we have studied starting from our school days. That polymers, generally we call them as the plastics as a common terminology, but they are not plastics. They are polymers specifically meant for certain specific purpose. So, polymer matrix composite, PMC. They may be particle reinforced, fiber reinforced, or structure. So there are three different categories of polymer matrix composite used as the biomaterials. Large particles, particle reinforced, dispersion strengthened, fiber reinforced may be continuous or discontinuous. Then structural polymers may be laminates or sandwich. Now in discontinuous, again aligned and randomly written. Now see, these four diagrams are important, which shows you how a polymer matrix composite is prepared. A continuously aligned matrix and the fiber. You can see this. It is a specific construction, just like our civil construction work. You can see the fibers along the axial path, and along which or in between them, the polymer matrix is there. So this becomes an integral part, and it contains the required mechanical properties, then the strength properties, then the biocompatibility, then the resistance to body fluids, and so on. Now here the discontinuous or the short fibers, here the fibers are not continuous like this, they are small fiber into small pieces and they are randomly oriented. Now the same part may be the resin and the reinforcement alternative, just like our plywood. So they are called as the laminates. Now these laminates are the sheet type of construction which forms a certain thickness and then they are given the shape. Now this is a typical laminate type of structure to manufacture a polymer matrix composite. While there is a sandwich pattern in which small pieces are vertically aligned, and these two pieces from top and bottom, they constitute the end of that particular product. So in between that, there may be other materials also, or generally, if it is only of two categories, then it may be the polymer and the reinforcement. So in polymer matrix composite, PMC, we are having this particular type of a construction. Okay. Okay, now the next part. Now, the major portion of my lecture will be constituting this particular part because till date, you will find that the PMC polymer matrix composites are in larger proportion, which are used in the medical application. So this chart, a short chart, can give you the idea about the application and the material. So the material is polyethylene, PE, which is having very good yield strength, hardness, opacity, resilience. The modulus in gigapascal is 95 to 150. Density is very light, 0.945 to 0.906 grams per centimeter. Processing is done as this is polyethylene. Injection molding, extrusion, then thermal trimming. Okay, so this is polyethylene. The cost is accessible. Now, in medical application, the very important part is that generally, if you go to any hospital, then they will ask you that what is your capacity to bear this particular replacement or repairs or any operation. Now, it depends upon the material. Now, if a polyethylene is considered, polyethylene is of low cost, so it is accessible to a normal person. Say, for example, we generally talk when we are talking for a particular disease that transplanting a heart is comparatively simple. Transplanting a liver is extremely difficult, or a kidney is intermediate in between them. Now, what makes this particular statement is about the cost. No doubt the patient's properties, its characteristics are important. Doctor skill is also required, but the cost is the major factor. So if you take polyethylene, it is accessible. So what are the application? Now this is very important. Pharmaceutical bottles, which we use for our day-to-day life. Then flexible containers, bags and tubes. A simple example is a blood bag, or a simple example is a saline tube. So they are made up of hospital grade polyethylene. Now we are not talking about that particular grades, but a polyethylene which we use in our day-to-day utility product and the polyethylene which is used for medical applications are totally different. Now they are manufactured in a very hygienic manufacturing unit with proper scale, no intervention of a person, no chances of any foreign growth of any microorganisms or any bacteria or anything. So this is the medical grade. So I'm not mentioning here, but try to understand that this is medical grade polyethylene. We are having different grades of materials. Then polypropylene, PP, it is having good hardness, yield strength, tensile strength, and resiliency. Modulus of elasticity is 70 to 150. The density is again 0.900 to 0.906. The manufacturing process is injection molding extrusion. It is also accessible. PP bags are very common for us. So they are generally used for membranes, then surgical threads, and artificial vascular grafts. Now generally we use the word a bypass surgery. Now in this bypass surgery, the veins which are generally the vascular grafts, that particular part is made up of this polypropylene, again the medical grade. Then polymethyl methacrylate, the short form is PTMA. Good yield strength, resilience, hardness, 270 to 320, 1 to 1.8. This is the higher version of this particular weight. Injection and extrusion, it is also accessible, PMMA. Then this is specifically useful for dental materials, membranes, intraocular lenses, contact lenses, and bone cement. Now this is a very typical one. generally, if you are having a glaucoma or a cataract, now generally we undergo a eye operation, where the intraocular lenses, again, these lenses are dependent upon the cost. So you will find that any operation of replacement of your lens, body lens in your eye may start from 45,000 and it may end to say 2,30,000. Now, what makes this difference? The difference is in between this material. So the material which is having very high purity and not having a very specific manufacturing technique, it will cost you very high. Just like our spectacles, it starts from 1,800 rupees to say 18,000 rupees. So that is the difference in the material. So the medical field, the operations cost generally depends upon these particular biomaterials. Then PU or the polyurethane is having good hardness, 60 to 200, 1.18 to 1.24. Injection molding, extrusion, and casting. Then these are expensive. PU, a common PU, we generally use in our day-to-day life also. Polyurethane. Sponge, it generally we use the word sponge. Now this is used for manufacturing tubes, surgical implants, then maxillofacial prosthesis. That means all the bones which are in our head, they are manufactured or they are generally support this particular polyurethane material. So anything in that particular one, except the metallic support, that is the hard support, the rest material is the polyurethane and it's costly. So generally, you'll find that any operation starting from your teeth onwards to the top side is a costly compared to the body from your bottom. That means from our legs, they are comparatively less costly because the materials for the replacement are very costly. Then the next and the very important group are the hydrogels. Now this is PHEMA, having good elasticity, shock resistance, amorphous. Now you can call this particular material as a wonder material because it is just similar to your body cartilage or the contact lenses or the retinal replacement. So this is a very wonder material, having 180 to 480 modulus, then 1.15 as the density. The generally manufacturing process is the extrusion molding. Then this is the expensive. Now where it is used, contact lenses, artificial skin. Now generally we use a very typical word, plastic surgery. So what is plastic surgery? Plastic surgery is the surgery made up of this, using this hydrogel. Now controlled drug dosing systems, then membranes for biosensor. Now persons who are from electronic field or electrical engineering, they might be knowing what are biosensors, which are used nowadays for sensing of different signals from a human body. So these particular are manufactured by this hydrogel. Now some details about hydrogel I will explain here because this is the most important part. Here I will take some privilege to explain that another aspect of this particular material biomaterial study is that nowadays engineering product manufacturing is not giving you good profit. But compared to engineering product manufacturing or domestic product manufacturing, if you enter or if you visit or if you observe, the material manufactured from medical requirements is having very, very huge profit. So it will be better if you study this particular part and if you promote or if you enter into a manufacturing of medical equipments, starting from their hardware to this particular soft tissue forming application, it is giving you extremely high profit. Now you might be knowing that a saline set which is manufactured on an average to rupees 17 per set, what cost we are paying in the hospitals? Extremely high, at least 8 to 10 times. Means what? Now this particular manufacturing is extremely profitable, except if you keep a proper hygiene and the requirements of the medical grade, you will find that the product manufactured will be of very low cost, but the selling price is extremely high. So that's why you will find that the whole of the system of medical field, how they work. Okay. Okay, hydrogel, which are extremely important in our day-to-day life. I'm giving you some examples and the applications. Ophthalmology. In eye surgery, most important application of hydrogels are vitreous implants, devices, glaucoma drainage, then sclerotic swelling agents, etc. In 1961, the process of obtaining soft contact lenses based on poly, that is hydroxyl methyl acrylate, was initiated by Gulian. Soft intraocular lenses have the advantage of folding, which allows the surgeon to make a tiny incision. When introducing them, they have an increased permeability to oxygen, preventing proteins absorption and the low surface. Now, this is very common, which you must have seen that during your eye surgery, generally the diabetes patient loses their sight, and generally they undergo this particular type of treatment, that is eye surgery, lens replacement. So in that case, you'll find that these lenses are so soft that the eye surgeon make a very small incision, and through injection, he introduces that particular lens at a required site, and you'll find that within 1 day, the whole of the system is set up. That means you don't have to wait for say 21 days or 30 days or 45 days for this particular system. It's an extremely important type of operation, and unfortunately nowadays, out of 100, around 40 to 50 persons undergo this particular type of treatment of replacement of his putting a lens in his eye. So this is an extremely important material. And for vitreous implants, in some cases of retinal detachments, hydrogels are used as the supplement, extend to replace the eye vitreous humor. For the replacement of vitreous humor are used more types of biodegradable hydrogels, are collagen-based, cellulose derivatives, or acrylic gel. Now, for ophthalmology, that means in anything which is connected with your eye. Now, generally, the products are manufactured from synthetic base, or it may be from natural base also. That means starting from our day-to-day proteins, which are obtained from different millets or say from milk, we manufacture different varieties of fundamental matrices, and these matrices are mixed with certain reinforcement, and we can manufacture these very fantastic components. Then plastic and reconstructive surgery, some hydrogels can be used as bandages, absorbent, tissue adhesives, etc. An example is cross-linked gelatin-based hydrogel with dextran dialdehyde used as the tissue dressing. Now, this is a very fantastic nowadays. You can see the reconstructive surgery. That means here the hydrogels, they are reaching to the tissue level. Generally, the title of this particular system is tissue engineering. Now you will find that the IITs have already started one branch, that is medical engineering, and which is dealing with all these materials, their manufacturing process, their characterization, then testing, and finally the application part. So this is a extremely important and the upcoming field of hydrogel. Then in orthopedics, hydrogel is used as surgical system for the cell reconstruction of the cranium. Now, these hydrogels are generally the replacement for our cartilage. In the last slide, I will try to show you one particular case study of this particular hydrogels, so it will be clear to you. Then bandages and coatings for sutures. That means the bandages, sutures, that means we are having certain type of construction which are done with the help of these bandages. Joints, it is used in various forms as bandages for wounds, especially burns, ulcer, and skin grafts. Now, unfortunately, the person who is undergoing the burn has to be treated with this particular system, because generally the skin is completely damaged and he has to provide with artificial skin. Generally, we call it as plastic surgery. Then pharmaceutical application, very wide application. Hydrogel allow under perfectly reproducible conditions, control loading and release of various physiological active substances, antibiotics, vaccines, anticoagulants, anti-tumor substances, microorganisms, enzymes, contraceptive, and antibacterial. That means whenever we take any injection for a disease removal, you will find that it is a pharmaceutical application. Even in our COVID days, we have taken different anti-COVID therapies where all these particular pharmaceutical applications were undergone. So this is a very important aspect of composite materials, specifically the plastic materials. Now this is a slight repetition of the part, but just to tell you these fundamentals. Feedstock of composites, that is for plastic, that is plastic PMC, thermoset and thermoplastic, fibers and resins, prepaid SMC, BMC. Now this slide is with reference to the manufacturing operation. At least you should know what are the different manufacturing processes which are suitable for these polymer matrix composite. Now fibers and resins, they start with filament winding, then pultrusion, then resin transfer molding, spray up and hand layup. Then for prepaid, you are having hand layup, roll wrapping, autoclave. These are the manufacturing process names. Then sheet metal compounds, bulk metal compound, then titanium matrix composites. Then generally the manufacturing process is compression molding. And for thermostatic composites, we are having fibers, resin, commingled fibers. Now this is, I think this is something wrong here. Filament winding, then tape winding, then pultrusion, then extrusion. These are the manufacturing processes. Then thermoplastic, prepeg or tape, autoclave, hot pressing, tape winding is the manufacturing process. And for molding compounds, injection molding. Now this bottom line indicate what different manufacturing processes are suitable for this very important group of composite material, that is the polymer matrix composite. Now we'll come to the next part, that is ceramic matrix composite. Now ceramic matrix composites may be classified into two categories. One is a group of toughened ceramics reinforced with particulates and whiskers. These materials exhibit brittle behavior in spite of considerable improvement in fracture toughness and strength. The maximum in fracture toughness is around 10 megapascal m square or more. The second consists of continuous fiber composites exhibiting quasi-ductile fracture behavior accompanied by extensive fiber pullout. The fracture toughness of this class can be higher than 20 when produced with weak interface between the fiber and matrix. Now this ceramic matrix, now the title itself is self-explanatory. Ceramics means they are hard. Now ceramics, they are hard, but unfortunately, when they are toughened, they become brittle. So the static components are suitable for ceramic matrix composite. That means when we make an implant where there is no bending load or the system is not generating any load directly on this particular ceramic matrix composite, where it is suitable. So ceramic matrix composite are having certain limitation. Number one, as they are very hard, so the manufacturing of this particular is basically difficult. And second point is that for dynamic systems, it becomes slightly difficult because it is brittle in nature. So ceramic matrix composites are to be treated, or they must be considered with this particular system. So here there is a chart. I'm not going to the detail of this particular chart. Starting from 1970 to 2000, what was the development? So generally in 1970, the main focus was on the carbon fibers. So in 70, carbon fibers as the reinforcing materials were targeted, and the development was in carbon fibers. Then in 80 to 90, now generally the glass metal ceramics, GMC, they were having the major focus. Then in 2000, you will find that now the oxide matrix, then other materials, they come into picture after 2000. And later on, in 2015 onwards, now we are going to the nano materials. Now starting from graphene to other materials or the microcarbon nanotubes and other things. Now the focus is shifted on the nanomaterials. So as the nanomaterial is not in our scope, so I'm not dealing with that particular part. So you can just have this particular look. 70 In 70, it was carbon fiber. Then later on, 80 to 90, it was glass metal composites, whereas silicon carbide, then other materials, silicon carbide fibers, then boron and nitrogen compounds with carbon, then oxide fibers, then oxide matrix was developed, then CVD coated silicon carbide along with the nitrogen, that is nitrides were taken. So carbon with interface oxidation were targeted in this particular era, that is 1982 to 1990. Later on, after 2000, you will find that it is shifted to pure biomaterials. And after that, nowadays, we are having nanomaterials. So the composite materials on a nanoscale manufacturing is nowadays the upcoming materials. So that is the next part, which will be after the composite materials. The historical evolution of fibers and ceramic matrix composites indicating some of the limits to the performance of commercial development. Now there is a limitation. Now generally in the industry, if you visit any industry, now it is a continuous cycle. When you develop a new material, a new process has to be manufactured. Whenever a new process is developed, it is favorable for new material development. So this is a cyclic process. So as this particular system continues, we'll find that there is a development, and nowadays we are having major focus on the nanomaterials because they are having more suitability than the conventional composite materials. So there are some examples of bioceramic material for dental and periodontal surgery. Now I'm just covering this particular one. Now all these short forms are explained in the next slide. So I'm just not repeating this. Surface coating, that is dental and maxillofacial implants, then dental implants, periodontal surgery, implants with alveolar and ridge augmentation, coatings for tissue growth. Now all these are the materials: HA, bioactive glass, glass ceramics, alumina. Then we're having phosphorus salt, bioactive glass, then alumina, then bone composites, which are autogenous bone composite, bioactive glass, then alumina, and so on. So it's a major part. Why I have covered this particular one? Because a normal person in his lifetime, after say 45 to 50 years, the first organ to start you troubling is your teeth. So generally, people have a good knowledge about the teeth and its surgeries, then implants, other things. That's why this particular part was covered. Next part, I will just read this. Okay. So now we are having the, I'm sorry, instead of this, I will go to the next one. Now, unfortunately, this is having a small text size, but this is very important for us. Where at the bottom, I'm mentioning certain materials. Now, first I will mention this particular certain material. CF stands for carbon fiber, C for carbon, GF for glass fiber, KF for Kevlar fiber, PMMA stands for polymethylene methacrylate, PS stands for polysulfones, PP is polypropylene, then UHMWP is ultra high molecular weight polyethylene, then PLDLA is lactide, PLLA is L-lactic acid, then PGA stands for polyglycolic acid, then PC for polycarbonate, then PEEK we have already considered, PMA is polymethyl methacrylate, then BIS. Now bisphenol, GMA, then PU is polyurethane, PTF is polytetrafluoroethylene, PET is the bottle manufacturer which we generally use day to day, that is polyethylene terephthalate, then PE is polyethyl acrylate, then SR stands for silicone rubber, PLA is a block copolymer of lactic acid and polyethylene glycol, LCP stands for liquid crystalline polymers, PHB is polyhydroxyl butyrate, PEG is polyethylene glycol, PHEMA, which is very important for us, is poly 2-hydroxylate, then methacrylate. Okay, so this I'll come to the previous slide. Now, a human body, here it is shown on the left hand side soft tissue biomaterials, and on the right hand side hard tissue biomaterials. Now see why this particular classification or why this particular type of a system is shown here, that at least we should know from this particular study that whether material under construction or our study is manufactured or utilized for soft tissues or for hard tissue. So this body skeleton, it shows in two halves, one with the skin and one without skin. So if you come to the hard part, then cranio-maxillofacial, metals, stainless steel, titanium, then ceramics, HAP, TCP, and polymers, P, PLA, PGA. I have just read this particular material now. So these materials are suitable for this particular application, means in human body, in his face, that means the upper part of your human body. Then the dental application, what are the metal composites? Gold, silver, titanium, stainless steel, palladium. In the older days, you must have used that in the older days. If there is a cavity in your teeth, we have to use some amalgam of gold and silver. Now that was an old story. Nowadays, generally this is avoided. Then these four materials were generally used as the metals. Palladium. Then ceramics were alumina, zirconia, calcium phosphate, glass ceramics. Polymers are PMMA, PTFE. Then for shoulder, that is humeral head, stainless steel, tantalum, titanium, vanadium, cobalt, tungsten, nickel, molybdenum. Now all these materials, now why we are making this particular study, so please remember that the application of a general material in human body, where it is suitable. Now this is the selection chart. Now this particular slide gives you a selection chart. A doctor asks you that a biomaterial suitable for this particular bone. Now here, this chart gives you, okay, what is this particular constituent? Now this constituent is the structural part. Now which one is suitable for this? Now we can land into this particular shoulder and the finger joints or the hip joint if it is here. Now we should have the selective materials, as these particular materials are already studied, then they are proven after say at least for 40 years, this particular system is proven. So here we need not go for anything else unless and otherwise demanded. Now please remember that biomaterials manufacturing is slightly reversed. That means a customer or a doctor gives you the properties, or he explains the requirement, and the designer and the manufacturer manufactured according to the requirement, just like our shape profile of our teeth. Now generally in the medical field, this particular type of designing takes place. So that's why this particular chart gives you a lot of information. So hip joint, then knee joint, then the bone joint. Different materials are like this. So how it is manufactured, or it is designated load bearing materials. So if you want in a bone load bearing material, so which one is important? Alumina, that is alumina, Al2O3, titanium, stainless steel. If it is a coating of a load bearing material, then it is a HAP, then calcium phosphate. If it is a fixation device, that means nuts and bolts, implants which are used for fixation of different parts, then it may be PMMA, PLACM, epoxy, and so on. So this becomes a selection chart. If you go on the left hand side, soft tissue biomaterials for eyes, PHAMA and HAMA copolymers, retinal surgery, silicones and PMMA. If it is ear, ceramic, glass ceramics, bioglass, polymers. If it is a heart wall, please remember soft tissue, heart wall. If it is occluder, then silastics, then leaflets, UHMPE, pyrolytic karma. If it is a stress, then titanium, then cobalt chromium alloys, then pyrolytic karma. It is serving ring, it is a silicone under knitted Teflon PP composite. Now you will find that this is a very important part. Silicone under knitted Teflon, that is polytetrafluoroethylene and polypropylene composite. So this is a very important aspect under biocomposite used in the serving ring. Then Teflon, Decron, PTFE fabric over silicone rubber filler. If it is a liver, anything in the liver tissue engineering, it will be polyester, PVC, or polyanhydride. If it is kidney, then it is polyester, PVC, polyanhydride. If it is tendons and ligaments, it is a PLACF, PTFE, PET, UHM-WP. Now this is tendons and ligaments. Generally, a common terminology in a common man is a cartilage. So we use generally this typical word. Then arterial processes, then it may be Teflon, Dacron, PU, and nylon. In short, this particular type of a study, now it clearly gives you the application part. Now, generally in engineering, what is done that if a surgeon or if a plastic surgeon or a orthopedician surgeon, if he gives you certain requirements, then generally a manufacturer try to fit the requirements in the existing material. If it is not possible for him to fit it into the existing material, he go for composite. If it does not fit into the composite material, then he goes for the nano materials, and so on. So this process is continuous. As there is a development in the manufacturing process, manufacturing industry, the material get developed, and if there is a development in the material, the manufacturing process is developed. So I will just go for the next slide. This is slide repetition. So what I will advise, at the time is very short now, I have to cover the next particular part. So I'll just omit this. I left this particular part to you. You can just go for the details. It is just similar like other previous slide. Here, some details are given. This particular picture is very clear, so that you can understand clearly the different parts of the body and where this particular biocomposites can be used. Okay. Now, as a general knowledge, we are using this particular slide where composite materials are applicable. Now, these are the applications. I'm not specifying any material for this, but these are the applications, are the wants of a surgeon or a doctor, where this particular application require biocomposites. So first is the prosthetic leg. So if, you must have seen that after amputation by certain diseases, a person is being supplied with an artificial leg. Now these are the prosthetic leg of different categories. Prosthetic limbs, then these are the injectable lenses for cataract. So these are the figures ABCD. You can see that how the injection makes your eye very clear. Then this is very typical. Generally, the persons having overweight or they are having the athletic run, generally their feet try to bend like this. As a result of it, your body weight doesn't go directly into the ground, but this particular bone starts suffering the body weight. As a result of which, you will find that many of the people, they are having the curved legs. So for them, generally, the solution is you have to provide him with the help of a stick so that the load is not transferred on the good leg, or otherwise his feet is supported with the profile like this so that it becomes a right angle. So this is called as a sole support. Now majority of you must have seen that if any person is having any problem with his feet, the doctor advises him to have a sleeper or a shoe which is supported with this sole. And this is a lumbar spacer. Now this lumbar spacer is trying to increase the distance between the two spines in our spinal cord, that is in our neck or the middle portion or at the bottom. So there are 3 sets. Now these are the metallic materials till date. No doubt another materials are also suitable, but metallic materials are more suitable because the surgeon advised that on this particular fitting there must be growth of a bone so that it becomes a normal system. So because this particular is a foreign material, if it is covered by a bone, that the body fluid do not act on this. So that is the idea behind this. So the same lumbar spacer in between the spine, this gap has to be provided or it has to be supported. Now these are the dental screws, implants, different types of shapes, sizes, and we are having bone screws for assemblies. Now different varieties of screws, just like, or even nowadays we are having the screws having certain typical properties like shock absorbing, just like our vehicle shock absorber. It is manufactured as a completely sealed, concealed system. It is also possible here. Then this is a femur or a long bone, which is the main part of our leg, the 2 supporting part. Then this is a contact lens, which is 100% transparent, then implantable cornea. This is also the most important part. Generally, the aged person require this particular type of surgery. And a very common part is the hearing aid. Now, these materials, now why I am showing this particular picture, the first and foremost requirement of this particular system is that the material which you are using must be biocompatible. Your body should accept this particular system. Now, here we have to understand two important facts. On this screen, I am trying to keep this one, but I am explaining typically. There are two considerations. External environment for an implant means your body fluid, depending upon its pH, start corroding the implant or the part which you are fitted in the system, or vice versa. The implant, suppose it is metallic, it starts disturbing the body fluid, changes its pH, or it manufacture or it produces certain fluids, acids or bases. So that is an internal part. So we are trying to balance. External means your body fluids, your body should not react on the implant, and your implant material should not damage your body. That's why these particular different types of materials are to be designed. So this is the fundamental of any implant or the biomaterial. Now, internal and external impact. So there are different properties starting from the weight, density, then the corrosion resistance, then the reaction with the body fluids, blood, then other fluids of your body, then unwanted material which are rejected from your body, say for urine and other thing. Now, these materials should not get affected, because anything which is placed in a urinary tract, you'll find that it will create a lot of pains in the system, because the system is extremely rigid. That means it will not accept any foreign material. A small kidney stone can generate a lot of pains in our body. So if you put any external device in it, now you are generating a very heavy pain to our urinary tract. So a person cannot bear all these things. So this is the importance, that is the external and the internal atmosphere of the system must be balanced. And the most important point is that the person should not feel that any external part is fitted in his body. So that is the feeling part, the comfort part of a human body, that after fitting, many times you will find that after knee replacement or a hip joint replacement, the patient always complains that I'm not getting satisfied, I'm having a lot of pains. Even after 30 days, 6 months, 1 year, he go on complaining. Means what? Either the fitment is wrong or his body is not accepting the thing. So the surgeon has to keep in his mind all these details. Okay. Now I'm giving you a small case study of a live tissue manufacturing. Now this is specifically with the help of a manufacturing process, 3D printing. Now majority of you must be knowing this fundamental of 3D printing technology, where certain materials are used to manufacture the tissues, human tissue. Specifically here, I am trying to show you one particular case where the cartilage in between two bones, how it is manufactured from a typical manufacturing process with a typical material. Okay, so I'll start with this case study. Live tissue manufacturing. Bio-ink is the material used to produce engineered or artificial live tissue using 3D printing technology. It can be composed only of cells, most cases, and additional carrier material that envelopes the cell is also added. This carrier material is usually biopolymer gel, which act as a 3D molecular scaffold. So the requirement is clearly mentioned. The most common way of using PEG, that is polyethylene glycol, as bio-ink is by mixing it with polyethylene glycol diacrylate DA to give PEGDA, or methacrylate MA to give PEGMA. In short, this combination of these different mixtures either forms PEGDA or PEGMA. Now this is our composite material which manufacture what is called as a bio gel. Now they are calling this as a bio ink in the terminology of 3D printing, but the material is either PEGDA or PEGMA. Although PEG is hydrophobic, it was found that the cells such as osteoblast can be encapsulated and survive well inside PEG biomaterial such as PEGMA. PEG has been mixed with other polymers to improve the mechanical properties. In addition, PEG is an ideal biomaterial for the use as a linker for conjugating different polymers in ink. Furthermore, viscosity of these bioinks was tunable to enhance the print feedability. In other study, PEGMA was combined with bioactive glass (BHA) nanoparticles to enhance the print feedability. Print feedability means in 3D printing, some liquid is poured from a jet through a nozzle, and it constructs the material as per our requirement. It is a totally CNC control system. So for that, the fidelity generally as the rate of flow of liquid or a wire or a solid material is generally called as the feedability in 3D printing machine. So that particular is a specific requirement here. So hydroxyapatite nanoparticles, HAP, NPS, have extensively been researched in bone tissue engineering due to the compositional and shape similarity to the mineral bone and excellent biocompatibility. However, HAP alone has low mechanical strength, which limits its application, and the mixture was used for human MSC, generally multi-potent stem cells, bioprinting. A high cell viability was observed along with higher compressive modulus of 350 kilopascal. Okay. Now the next part is the last slide. Actually, I'm trying to show you. This slide gives you in a clockwise direction the requirement and how this particular system works. Okay. Now try to understand with reference to the previous slide. If you consider PEGMA or PEG MA or PEG specifically, or PEGDA. So with this raw material, how the manufacturing is obtained. Now this particular is the requirement. How it starts: imaging of patient bone or cartilage defect performed. Now this is the imaging. So you know that nowadays MRI or the X-ray or ultrasound therapy will generate a picture like this. Then it will be in different angles. So it may generate even the 3D model, or even the software will generate the 3D component requirement as an inspection module, testing module. So a surgeon can understand what is the exact requirement. So this is the second part. CAD model created from clinical imaging data. It is like this. CAD model slice into G codes that 3D printer can read. Now, majority of you might be knowing how a 3D printer works. So you require the slicing of this particular image into infinite slices, which is fed to the machine. It is converted into G code so that the motion of that particular machine in different axes and the directions can take place. So that is the requirement. So a CAD model, computer aided design model, will look like this. Now the next will be, this is the system. Patient cells harvested and expand in culture. Now what is done? That this is the requirement of a human body, while the previous material, which is artificial hydrogel, for which the patient cells are taken from an injection. Now from this cells and the material, and culture is developed. Now this culture will generate the tissues as per our requirement. So this is the culture development, which is mixture of a human body material and the artificial material to a required size and shape. It may be directly in situ, or it may be developed in a laboratory, then shaped to a required size and dimension, and then fitted into the system. So this is the third part. Patient cells harvested and expanded in a culture. So this is a combination which is generally done in the tissue engineering laboratory. Then the next part is that bioink containing biomaterials prepared So a bio ink which consists of all these things, and the synthetic material is prepared. Cells are encapsulated within bio ink, ready for 3D printing. So what is done? Generally, the cells are covered by the bio ink. That means the plastic or our polymeric composite is a cover, just like our capsule, and the actual cells are embedded in it. And from that, a 3D printer starts. Now, these are the two nozzles of 3D printing. So, bioprinting of 3D constructed is performed. So, whenever there is a biocomposite material, then there is a injection of this particular composite bio cells in between that. Now, this decides either a raw shape, or this decide if it is a perfect shape which is to be printed in your body. So after manufacturing of this is the 3D printing manufacturing with a bio ink, which is generally in a tissue engineering laboratory, which is a combination of microbiology and engineering. So it manufactures what is called as a particular material, and now this material is fitted in the body. So construct matured in vitro for testing or implanted in vivo into patient defect. So this may be tested outside, or this may be fitted in the human body, and then the testing is done. So generally, this is a continuous monitoring while operation is in process, that what happens to that particular biomaterial when it is put in required position, and as a result of which whether it is suitable, it is acceptable to your body, because you know that your body is so much reflexive that anything is injected in your body, immediately it starts giving you the senses. Either it is in the form of a pulse, it is in the form of a pain, it is in the form of a sensory part to your brain. So your brain immediately start sending the anti part directly to your body or to that particular place, and as a result of which you start, a typical observation is swelling. That means if anything goes into body, blood comes out or a pus comes out, or immediately you find that your body starts swelling. So these are the reactions or the reflexes from your brain. So this is continuously monitored, and that particular monitoring is done continuously to the patient during the operation and for a certain period of time as decided by that particular doctor. So generally after such operations, you are advised to take rest in that particular position, or in that ICU or semi-ICU or in the wards, and continuously monitoring is done. So it is generally observed that even, I'll give you a simple example, that even if you are having a cut and if you have undergone certain stitches, you find that out of 10 stitches, 6 to 7 are okay, but while 1 or 2 stitch goes wrong, immediately you find that a pus starts coming out from that. So for such a major operation, a continuous monitoring is required, and different type of observation systems are there. So this manufactured. So here, what was that particular system which we have considered, that looking at this particular problem defect. Now this is the picture. After that, this particular is the manufacturing portion, and after manufacturing, this is a surgery or the operation. So after surgery, depending upon the age of the patient, now this monitoring is continuing, and then later a decision is taken. What is that particular decision? If the patient says that he is comfortable, then this continues. If he says he is not comfortable, then again certain repair techniques are used so that he becomes comfortable. So please understand that this particular type of an operation is a major surgery where you are inserting a completely externally manufactured part in your body. See, our body is so much reflexive that even a small particle entering in our eye, you become immediately discomfortable. You cannot remain comfortable. If anything enters in your leg or in your feet, immediately you stop painting. If even while biting anything, if anything enters in our teeth, you find that it becomes very uncomfortable. So in such major surgeries, the pain or other things plays very important role. Your body starts giving the signal, and the surgeon has to monitor all these things. So this is the future of our biomaterial. So why I'm giving you this particular case study, that this is the future which combines the materials, then the metallurgy, which combines the manufacturing process. It contains the microbiology, it contains the tissue engineering, it contains the medical field, it contains the surgery, and finally the patient becomes good in his health, or he is satisfied with what is going on, what is inserted in his life, in his body. So in his lifetime, he has to consider all these things as a foreign body, and generally the person bears, fortunately with these composite materials and the nanomaterials, majority times around 80 to 85% patients are getting lot of relief from his disease by inserting this particular biomaterial. So with this, I will try to conclude my lecture with a simple note that the biomaterials which we are utilizing in this particular system, these biomaterials are extremely comfortable till date with an average. If you reduce the average, you can just say that if you reduce the average, around 55 to 65% of the patient, that particular part is nowadays considered as a very good output from the biomaterial surgery, or the replacement, or the repairs, or the services which is obtained from these biomaterials. So I will advise one important point, that as this is an interdisciplinary subject, now all the students, teachers, and the professional from field of material science, engineering, or say the technology, or even the medical field students must study the biomaterial, because as the age progresses nowadays, the utilization of biomaterial is increasing with an exponential rate. Now this is not a flat rate, it is an exponential rate, because now we are observing from our school days to right now that the new generation is having a lot of health problems. The most important one, because the utilization of the mobile and electronic gadgets, their eyes are extremely big. Because of the food like burgers and other things, you'll find that their teeth are not developed, their teeth are having a lot of problems. Say an eye and the teeth are extremely common, you can say, the substrate for biomaterials. So with this, we have to understand these particular biomaterials. This is the future of engineering as well as medical. So that's why the IIT has started the medical engineering branch, looking into accounted to this particular very heavy utilization of this particular materials. So with this concluding note, I will conclude my lecture. So thanks to all the concerned persons for giving me this particular opportunity. If anybody is having any question or query or any doubt, I will try my level best to answer it. So thank you very much.
Thank you very much, sir, for your informative session. Is anybody interested to ask the question? If you have any doubt, you can ask. The session is open for the discussion. Sir.
Yes, sir.
I have one doubt.
Yes, yes. Definitely.
Mention the metal matrix composites.
Yes.
Some Ti6, Al4, such
Yes.
terminologies.
Okay, okay.
What the Ti6 stands for,
Okay.
or 4 stands for?
Okay. Now this is the method of explanation of any alloy. Ti is first digit, or the first letter stands for the matrix Ti. 6 Al means 6% of aluminum. If it is 4% V means 4% vanadium. So this is the terminology for that alloy, which is matrix alloy. Because generally pure, instead of pure titanium, for improvement in the strength and other properties, we generally use alloy. So this is the designation system of alloy. That is, titanium is the matrix, then 6Al stands for 6% aluminum, 4V or Ni stands for 4% vanadium or 4% nickel, and so on. That means it is the name of that particular element.
Okay, sir. Okay, thank you. And one more, that what is the life of various implants
Okay.
in our body?
Okay, this is a very much, or you can say, $1,000,000 question. Now, the manufacturing nowadays starts from a average to high cost. Now, it is not low, average. I'll just give you one particular example, that if you go for a implant for teeth, so the dentist will give you the choice. He will say that, okay, I'm putting this, I'm replacing your teeth. It is an implant. So you have a choice. That means he will ask you whether you do require the metallic or a ceramic or anything else. So you will find that replacement of a teeth starts from 35,000 and it may reach 80,000 to an average or even more. Now this is the system offered by the manufacturer depending upon the age of that particular person. Now, please remember, the implant and other things, they are totally, when you are putting something in your body, immediately the doctor says that what is the age of that particular patient. If the patient is of lower category, that means if his age is 25, then he will advise you to select an implant which is having more life. Say, he will give you advice that go for ceramic composites. That will be lasting for 20 years or say 15 years. After 15 years, nobody can guarantee, or 20 years, nobody can guarantee. If the patient is of 65 years, then he will say that, okay, now the average life of that particular person is over. So instead of paying, or instead of using a ceramic material which is having guarantee of 20 or 25 years, you better go for this particular one, because of the another thing, that you may put a ceramic material as an implant, but as the aging process continues, the bones of your jaws get degraded. Then what is the use of that particular, when the bones of your jaws have degraded, they don't have any strength. Now what is the use, or what is the purpose of putting a teeth having very high strength? Because that is the supporting material, it is the base. The base is weak, while the implant is costly, that doesn't support. So this is a typical decision with reference to the age of a person, his lifestyle, it is his pocket or the money which he is ready to spend, and the judgment of that particular surgeon. So all these things are, what you can say, dependent upon the judgment. It is not a direct law that, okay, this is the person, put this particular material. Majority of the old age person, they are not capable of chewing. So in that case, it is better to have the low cost implant than high cost implant, because their lifestyle, then their hunger, then their capacity has reduced. If a person of 72 age, he is not utilizing, or he is not eating hard substances, so he is using, or his food is very much soft. So it is not necessary for us or for a surgeon to suggest that go for a ceramic implant. So it is a what you can say, the selection based upon the mutual understanding. Yes, I think that this answer is will be helpful.
Yes, sir. Yes. Thank you. Thank you very much, sir.
Thanks.
Is anybody, you can unmute your mic and you can ask the question. Dear participants, you can unmute your mic and ask the question. Okay, sir. Okay. Thank you. Thank you very much.
Thank you very much, sir. Thank you. Thanks a lot.
It's very informative, very excellent. Your knowledge in the field of metal matrix composites and its applications in the medical field, it's really amazing, sir. I
Hello,
hope.
sir.
Yes, sir. Yes. Anyone?
Hello, sir.
Sir. Deshmukh, sir. Please.
Namaskar, sir.
Namaskar. Namaskar.
Please ask, sir.
Sir, which type of nanomaterial is majority used in medical science?
So actually, the nanomaterials are not separated. All these biocomposites, what we generally call them as biocomposite, they are converted into nanomaterials. That means the materials remain same. Only thing is that now they are on a nano scale. We are just changing the scale. Whatever we have studied now as the biomaterials, all are suitable. Only the manufacturing process is the nano scale. That means instead of conventional manufacturing, you go for nano manufacturing. That means it is the same part which we have considered right now. All the three categories remain same. Only thing is the scale of manufacturing differs, because it is if you know something about tissue engineering. Now I will just give you one example so that what is the scale of manufacturing that will be justified. Now say in the older days or till now, we know that there are two branches of medical sciences, that is the Ayurveda and the homeopathy. Now in Ayurveda, you will find that the Ayurvedic doctor generally he prefers to give you the churna or bhasma instead of a solid material. Now the churna or the bhasma, being a nanoscale, it is directly absorbed in your body without undergoing the metabolic system. But allopathy says that a capsule or that particular part, majority of the system has to go under metabolic system. That means it enters into the metabolic system and then it is taken to a required location or the disease. Suppose you are having a certain liver disease, then it starts from that particular point to the liver. But the churna or the homeopathic titrations, so generally 1x, 2x, 10x, 1m, now that starts getting digested when you keep that particular pill or a small tablet in your mouth. So through the saliva, through that particular system, it directly start entering into the system. So no need to enter into the metabolic activities. So majority times it is observed that if the diagnosis is perfect of a homeopathic or a Ayurvedic doctor, you will find that you will get a miraculous result because their therapy completely based upon the nanotechnology. So nowadays, allopathy has already accepted this particular system. So now they are shifting to this particular type of system, that is nano medicines. Now these nano medicines are to the point. That means if you put a capsule which is having a particular life of, say for example, 3 seconds, after 3 seconds, when it is entering into your mouth, after 3 seconds, what will be its destination? At that point, it will start dissolving and the medicines will come out and it will start working on that particular tissues. So this is the nano scale of nano manufacturing. Means what? The biomaterials remain same. Only thing is that now the size of that particular medicine has been drastically reduces to 10⁻⁻⁶ millimeter. That is the nano scale, and its efficacy increases because our body is having majority of the part with water fluids, and so dissolving these particular fluids in water on a nanoscale is simple, and digesting into a required system is also simple. So instead of a solid material, the same disease curing system, if it is on a nano scale, it will start acting very fast. So that is the only difference. The materials are same. Materials do not differ.
Okay, thank you, sir. Good. Thank you.
Okay.
Hello, sir.
Thank you. Thank you very much, sir.
Hello, sir.
Okay, thanks a lot.
Anyone else?
Hello, sir.
Hello.
These materials, composite materials are connected with the repairing or connecting the bones. Implantations are used for the repairing the fractures. So, why it is necessary to take the in nanoscale?
See, there are two reasons. Number one, nano manufacturing is pinpointed manufacturing. That means it will not be requiring the mixture of different materials, because wherever you require, say for example, a calcium is the major part of your bone. calcium we can consume from our day-to-day vegetables and day-to-day intake. But whenever large calcium intake is required, as in the case of elderly people, generally drinking more milk is not a solution. That means on a large scale. But providing calcium through a tablet on a nano scale will get absorbed in your body, reach to the bone, then make that particular bone of more strength, is more easy, less time consuming. So nanoscale disease curing on a tissue level is more advisable, because whenever you mix more than one substances, naturally out of this, one or another substance will be having certain reaction with your body. Now this is a common thing which we come across with allopathy, that a doctor gives you at least 8 or 10 tablets. He is asking you to consume say 3 or 4 tablets at a time. So generally what is a common observation, that one or another portion of that that particular medicine start generating acidity. So he gives you an antacid for that. So instead of going with this reverse technique, that first generate acid and then provide antacid, this is not a proper way. Instead of that, take that particular material or the part of your biomedicine to a point in a nanoscale, provide it as it is a tissue engineering system. Immediately it gets absorbed. It is absorbed in your body, and your body start flourishing. Please remember that our body work on the mechanism that majority of the diseases are cured by the body itself. If you provide the required minerals, proteins, and other parts to your body is capable of curing the diseases itself by itself. So this is the fundamental principle. All these medicines are the artificial supplements. These artificial supplements should be as minimum as possible to cure your diseases. Generally, whenever it is in the powder form requires number of additions. It is on the solid part. So for that, your body has to work more. But if it is on a nanoscale, it has to work less. So it consumes less time. So naturally, your curing of the disease is in less time. Coming to your answer, coming to your point, if a bone constitutes more calcium, so our job not to give a big tablet having milligrams of calcium and other things which are not useful for curing of the disease, which will generate something else, certain reactions, certain allergy. Instead of that, provide only calcium to a required point, so it becomes a nanoscale. Okay. I think my answer is.
Thank you. Thank you, sir. Due to the time constraint, I will end the question answer session here. Thank you very much.
Thanks a lot, sir.
Your thorough information, knowledge regarding this applications of composites in the medical implants is really helpful for our participants. I thank you on the behalf of Sri Siddheshwar Women's College of Engineering, Solapur, AICTE ATAL, and all the participants. Thank you, sir. Thank you very much.
Okay.
So all the participants, don't leave the meeting. We will start the next session immediately. And next session is by Dr. Dattakumar Mamane sir. Our guest has joined. Dattakumar Mamane sir is already joined here. Mamane sir?
Yes, sir, I am here.
Yes, sir. Thank you.
Am I audible?
Yes, sir, you are audible. So, I will take the privilege to introduce our next speaker, Dr. Dattakumar Mamane. Dr. Dattakumar Suresh Mamane works as a faculty in the Department of Chemistry at Sanghameshwar College, Solapur. He obtained his PhD from National Chemical Laboratory, Pune in 2014. He worked on graphene synthesis for energy storage applications. He did his postdoc research from 2014 to 2016 at Yonsei University, Seoul, South Korea. He also worked at Nanyang Technological University, Singapore in 2011. Till date, he has more than 35 high-impact publications to his credit, and few more papers and review are in pipeline. His total citation crossed 1500 and achieved H index of 18. He has been selected as the Young Associate of Maharashtra Academy of Science in December 2023. This prestigious award is given for outstanding research scientist in science and technology. In chemical sciences, only 8 awards are declared, and he is one of them. In his career span of last 15 years, Dr. Mamane has performed research in the field of material science, covering both novel synthesis of oxides and carbon-based materials and their energy-related applications. Over the years, he has worked in many areas related to energy and environment, more specifically, development of carbon and oxide-based electrodes for supercapacitors, lithium-ion batteries, etc. So, such a wide research experience resource person is with us. So, I welcome Dr. Mamane sir on the behalf of Sri Siddheshwar Women's College of Engineering, Solapur, AICTE, ATAL, and all the participants. So, without wasting much time, I request Mamane sir to start his session. Over to you, sir.
Good evening, everybody. Am I audible, sir?
Yes, sir. Yes, sir.
I request everyone to mute their mics. Firstly, thank you, Professor Avinash Patil, sir, and also his team for inviting me for this 6 days workshop on modern technologies, that is advanced materials based modern technology. I'm sure all the team is doing wonderful job at Sri Siddheshwar Women's Engineering College. They are doing wonderful job and motivating and mentoring young engineers, we can say. So I must thank him as well for the detailed and kind introduction. So today we'll be focusing on research. What kind of thing is needed for research? So personally, I think we need to observe the things very carefully. So the observation is the only thing that is needed, that is required for the good quality of research, we can say. So what is the importance of observation? What I think is it increases the depth of understanding. So for observation, what we need is an interest that has to be developed in each and everybody who is interested in research. So we need enough knowledge, enough curiosity, and then we will be able to observe the things and we can comment on that particular thing. That's what I think. So our nature of neglectance is not going to work in the field of research. So to increase observation, yes, we need to give the time, and it's definitely going to enhance the research skills. That's what I think. So in the next time, whatever the 1 hour, a few minutes allotted to me, I'll be giving some examples of the things that I'm doing in my laboratory with my PhD students, and I will try to communicate the message that what kind of nano things that we are doing in our laboratory. So I will try to communicate with all of you in this 1 hour. So with this short introduction, I would like to share the PPT first. Can anybody tell me whether it is shared? If you answer in chat box,
Okay.
that is okay.
Not yet, sir.
Sir, it is giving me a message that you are not allowed to share your PPT.
Now it is coming, sir.
Okay, okay.
So continue, sir. It is displayed.
Okay. Is it shared?
Yes, yes, yes. Your screen is visible now.
Okay. Let me maximize this. Let me highlight with a pointer, laser pointer. So welcome to the Nano World, everybody. Okay. So let me tell you that I'll be using two languages, English as well as Hindi, although my Hindi is not that good, but I will try to speak in English, and then if possible at some places I'll be using Hindi, because I came to know that all of you are coming across the India, so that is good. So people, please try to jump into the chat box and type whether it is okay or not, yes or no. Please type into the chat box. So I request to interact through the chat box, and definitely I will try to give my best in today's lecture. So this is the title of my talk, and I am working with Sangameshwar College, Solapur. My name is Datta Kumar, and my today's topic is nanotechnology and research opportunities. So at the end, I have written there that towards more sustainable solutions. So nanotechnology will be useful to all of us, or the people who are engaged in the field of research, okay, to find out the solution, sustainable solutions with the help of nanotechnology, and of course, research opportunities are coming. So I have pasted a photograph of sun there to indicate that the sun is free all time. Okay, I mean during the daytime, it is giving tremendous amount of energy to us. Okay, and what is important is that the energy is coming in distributed manner. It is not coming in one direction. It is coming in a diluted form, but it is free. It is not going to send any kind of bill to us. That is very important. So how we can utilize this sun, that is one of the sustainable solutions we can say for the development of nanotechnology, that we will be discussing in this talk today. So that is why I have written here towards more sustainable solutions. Okay, so coming to the next slide, what is important?
Sir, I will interrupt. Your slides are not moved. Next slide is not coming.
Is that? I think it is coming.
Full screen. Make it full screen, sir.
Yeah, it is in full screen.
Only the first welcome slide is there.
No, actually press F5 so that it can be visible on the whole screen of the monitor.
Slideshow.
Slides, so right, yeah.
Yeah, I have already pressed that.
But that's not showing on the screen, on our screen actually.
Wait a moment, I will read it.
Sir, while sharing the screen, please select the
No, I have done that. There may be some problem. Can you see now?
Yes, sir. Second slide is there. Third slide is there now.
See, now welcome to the nano world is there, right?
Actually, now third screen is visible.
I think it is taking too much time.
Second slide is there. I mean, slide is changed, but it's not coming on the full screen.
Full screen is not coming.
What about now? Is it coming?
No. The same.
Oh my God, what is happening? I don't understand. I have
Slideshow.
Yeah, I have done that slideshow.
Yeah, slideshow. Try to press F5.
Yes, sir, I did that. I have pressed the F5.
Yes, sir, now it's visible.
It's good now. Yeah, it's again done.
Yeah, is it visible now?
It was visible for a while actually.
It was visible for a while. Again, it has come to the small size.
I don't understand. Sir, wait for a minute.
Mamane sir.
Yes, sir.
Please click that one. Whatever just now you have brought the cursor na.
Yes.
The cursor at the bottom of that one, you can see here. At the bottom where there is a minimize and plus and minus sign, it is there now.
Yes, sir. I did that.
Press that one.
I have ended the show again and again. I am trying the same thing and it is coming and going. I have pressed F5 and the slide.
Okay. Wait, sir. Wait. Patil sir, can we continue with this only if it is not coming?
Sir, sir, what I do? Can I send my presentation to you?
Yeah. That is better.
I don't know what is happening. Ek minute, I will do restart again. What is happening? I will check one more time. I will completely close and restart.
Yes, sir. Yes.
Maybe that will work.
Mamane sir, while when you are clicking on presentation mode, then when you are sharing your screen, at that time you have to select presentation window only.
Yes, madam.
Don't
I am
select the PPT window.
yeah. I'm doing the same thing. I have taken a lot of lectures, so I know that. Still, thank you for the suggestion. I will do it one more time. Okay. Okay. Is it shared?
Not yet. Yes. It is there, but not in full screen.
No, I haven't done that. I will do now.
Please, sir.
Sir, check please one time whether it is in full screen.
Not yet, sir.
Mm.
Will you share to me, sir?
Okay.
Will it come to WhatsApp?
Yes, sir. I will send on email ID.
Okay.
Or wait a moment.
Email is okay.
Can you share me on WhatsApp your email ID?
Yes, sir. Yes.
I don't understand what has happened.
I have sent the email.
Yes, sir. Yes, I got that. I'm extremely sorry, all the participants. I don't know.
No issue. No problem.
It's okay, sir. It's happened. It's technical glitch.
Avinash, sir, can you check?
One. Not received yet.
It's completely missed.
You can also try to WhatsApp.
WhatsApp, yeah. I'm trying the same. It is larger file, it's saying. Everything is
Attendance.
meanwhile you can share the previous things which are pending so that the participants will do their job if something is pending.
Not yet.
Okay. Sir, can you check? I have shared on
WhatsApp.
your Google Drive.
Yes, sir. Right.
Have you received?
Yes, sir. Yes.
Okay.
I'm downloading it.
Okay.
SSWCOE FDP.
Yes, yes, yes.
Ah, that is.
It is now in F5 mode. Is it now visible or no?
No, sir. No.
So can you tell me, is it second slide or first slide right now?
It is second.
So if I continue with this, is it okay? I mean,
it is downloaded at my side.
okay, okay. Let's try from your side.
Yeah.
What has happened to this?
Sir, you stop your sharing.
Okay. Yes, I have stopped that.
Window game. एंटर स्क्रीन करता हूँ एंटर Hello, sir.
Yes, sir.
So you can start now.
Okay. Can you go to the next slide? Yes.
Yes.
So the title of my talk is nanotechnology. Can you press one more?
Yeah.
Nanotechnology and research opportunities. So towards more sustainable solutions, we can say. And this is my third slide. World is changing rapidly. We are towards more in the era of more advancement, we can say. We have people are working on flying cars. Flying cars means traveling on road, but due to traffic jam, just upliftment at few meter and again coming down to the road and again travel. Again, the next is driverless car. I mean, driver is there, but he is not driving. He can read the book, he can watch something on the mobile, so on and so forth. So these kind of things are we can say that we are in more advancement era. That is, world is changing rapidly. So we already have the electric vehicles in the market. So this is kind of green initiative people are saying, but we don't know what is happening in coming days. Maybe after a few years there is a lot of lithium waste, that these kind of vehicles are containing large lithium ion batteries, which is not again the safe. I mean, we are also traveling with electric scooters. Almost many people have purchased that particular electric vehicle, that consumes electricity, and there is a zero emission kind of thing is that. Again, if you see at the fourth image, whether the cursor is there, sir?
Yes, sir.
I mean, I'm highlighting the fourth image, whether it is highlighting there. Okay.
No, sir. No.
Okay, it's okay. The fourth image is the related to foldable display, foldable screen, which is like 18 to 20 inches, developed by LG, but it is in initial stage. Definitely, people will have a handkerchief like display or TV in their pockets or in their bags, and they can go anywhere, and they can while traveling or while gathering at that time, they can see the television, the foldable television, and it has its own advantage. So what is used in that? In that particular thing, people are using nanomaterials, and nanotechnology is playing the role in the development of such things. Again, robotics, the chips, transistors are present there, also contains nanomaterials. Artificial intelligence is also there, and then flexible electronics. We can wear the electronic devices on our hand. You can see the mobile in the last image, and the smart city. Everything is smart. People want smart things like smart home, smart city, all the facilities, so on and so forth. And again, data science, which is also important, we cannot neglect. So in short, or in the brief, at the end of this slide, we can say that we are in the era of more advancement, and world is changing rapidly. Can you go to the next slide, please?
Yes, sir.
So what we are doing, we are developing, we are trying to develop, and for development, energy is needed. We all know that. So for energy, in order to have energy, power is a requirement, or for the development, we can say that there is a requirement of a power. Power is a basic requirement of the development. So you can see the well-developed bridges, bullet trains are there, and for doing development, we are creating a pollution. You can see the air pollution, you can see the water pollution. Although we are powering the earth, but pollution we cannot avoid. And as the combination of energy, power, and pollution is considered, we are suffering from a severe health issue. So in the ancient people were about to live for more than 95, 90 years because there is no pollution. So on the one hand, we are saying that we are developing in terms of advancement or technology, but at the same time, we are not avoiding pollution. And because of that, we can say that health is a serious effect, and we are not healthy. And that is why that picture is there, that I pasted there. I don't feel well. So even though development is there, not feeling well because of health issue is also going on. So development is there, but its effects or its consequence cannot be avoided. That is important. That is why I shared this. Next slide, sir. Okay. So again, if we focus on development, development is there only at few places in India, like big cities like Bangalore, Pune, Mumbai, Hyderabad. Okay. So these are urban cities, urban areas, we can say. They're 24 hours power, grid storage, the grid connectivity is there, and because of that, 24 hours power is there. But at the same time, more than 60% of places, okay, they are not having the electricity. They are struggling for electricity. You can see the people are going with the lantern, and girls are studying okay, in without light, or there is just not the electricity, the other things are there, and you can see the development. There are no buildings, nothing is there. So there is one movie in that movie, it is shown that the scientists working in NASA, when come in holidays to come in his village in holidays, he tried to produce electricity. So that was the I think 2002 movie. So this, okay, but now also people are struggling with the electricity. So that lady shown at the right side, upper side, is first time receiving the light, and she says bijli. So she's so happy to looking at the electricity, and that's why it is written there, 70-year-old lady's house gets electricity for the first time. So we have two types of things, or two types of places in India, we can say. So even though the development is there, but it is not fully developed, we have a development only at few places. Sir, can we go to the next slide? So India has been facing another problem in terms of development that we can say. Okay. So what is sustainability? So sustainability, okay, try to understand. It should be an endless process. It should be an endless process. So what is sustainability? It is nothing but the avoidance of the depletion of natural resources in order to maintain an ecological balance. Can you next, please, sir?
Yes.
2 times. Okay. So why sustainability is so important? So we all aware that petrol is running out from us, and we are using too much of fossil fuels. I mean, and we need to minimize these use of these fossil fuels, so that there should be ecological balance on the earth, we can say that. So what is sustainability? Sustainability is an endless process, we can say. Then and then only it's possible to have something better. Okay. So there are many sustainability development goals. Okay. So can you go to the next slide, please? Okay. So there are 17 United Nations Sustainable Development Goals that I studied from the website, and the first is no poverty, then the zero hunger, then third is good health and well-being, fourth is quality education, and that is for everyone, not for few people. Again, life on land. Again, the next thing is peace, justice, and strong institutions, partnership for the goals, life below water. Okay. And then few next are also listed here: industry, innovation and infrastructure, reduce the inequalities, sustainable cities and communities, that is important. Okay. Responsible consumption and climate action. And then finally, clean water and sanitation. And here comes the important one, is that affordable and clean energy, decent work and economic growth. Next, please. Reduce inequalities. Next, please. So what is important? The important is affordable and clean energy as far as the point of nanotechnology is considered. So the clean energy is very important, and if a researcher focus on clean energy, he or she has to focus on nanotechnology. And if we focus on clean energy, definitely other points are going to implement. The other development goals are also going to implement. So the number, I don't remember the number of goal which is related to clean energy, is very important as far as nanotechnologies is considered. So once the clean energy goal is achieved, can be achieved, the other things or other goals can be automatically managed. I mean, not all the goals, few of the goals. I don't know much details about the other goals, but as a nanotechnology, I came to know that we have to focus on clean energy. Okay. So on the other hand, I told you environmental is facing the problem, and there is an opportunity for a material scientist to work. With the help of nanotechnology, we can overcome the environmental related problems. Next. So we have healthy lifestyle, I told you, but because of environmental pollution, maybe air pollution, water pollution, any kind of pollution, health is a serious problem. We all know that. So what is the problem? We have water shortage. I have shown the clear-cut image, but when you go to the villages, there is still tanker is coming. Even in cities, few areas, the water supply with the help of tanker is going on. So what is the thing? The thing is that there is a water shortage for everybody. I mean, many people, not everybody. The people living in cities, they are getting 2 times of water. But I live in Solapur. We are getting water. I mean, every 4 days after we are getting the drinking water, so on and so forth. So water shortage is a major concern, environmental problems, we can say that. And here is the opportunity for a nanotechnology. What we can do? So we have a sea water, many coastal lines are there, so we can desalinate. So salt should be removed from the water and make that water available for drink. Of course, it is a tedious process. It requires a lot of techniques, but this is one of the solutions. With the help of nanotechnology, we can do. Of course, some advantages and disadvantages are there, but always we have to try for a solution. And once we try, definitely we'll get the answer. And the second thing is that water purification. Next, please. So water purification, it means that water is due to industrial effluents, it is associated with arsenic and chromium 6 impurity. Chromium 6 is the oxidation state of a chromium. So clean water is a right of everybody, and many more than 50% or 60%, I don't have the correct figure, but people are not getting on time water or drinking water, so on and so forth. And that is why this is also the area, that environmental problem we can reduce with the help of nanotechnology. That's what I think. The nanotechnology helps to find the solution, or we can say that material scientists can find the solution for the solar desalination of water. Again, the word solar is there, so we can use the sun. That I highlighted in the first slide. So solar desalination of water and water purification, these are the two important areas of related to environmental problems, and one can work in this area, and this is very simple. Can you go to the next slide, please? Okay. There is one picture. Is it not highlighted? Okay. Can you go back? Can you go back? Go back. That hexagon image. Yes. So there is an image that is showing the emission of carbon dioxide in the world. So there are many countries, CO2 emission data is shown in that particular graph. But if you try to calculate the CO2 emission quantity, almost 50% or more than 50% CO2 emission is only from US, India, and China. So we have to control on carbon dioxide, carbon emission from the vehicle, from the industry, many things. So we have to control carbon dioxide emission, and that is the aim. Next, please. Okay. So the aim of the India by 2070 is next is to there should be a zero emission of carbon dioxide by 2070. So for that purpose, our government had made a plan. It is divided into 3 sections. The plan 1 is reducing carbon dioxide emission completely. I mean 1 billion tons by 2030. Okay. So carbon dioxide is the greenhouse gas. We all know that it has a serious problem. Global warming is there, and then level of water, ground level of water is increased because of greenhouse gas, that is carbon dioxide is a major player or major pollutant or major green gas, we can say. And the plan 2 is to produce the 500 gigawatt energy. Okay, non-fossil fuel. It's not fossil fuel. I mean, I want to talk about a renewable kind of thing. So by 2030, this is the aim. Then fulfillment of at least half of the energy requirement via renewable energy sources. Okay, by 2030. And the plan 3 is that reducing carbon emission intensity below 45%. जो कुछ कार्बन डाइऑक्साइड एमिट हो रहा है उसका 50% तो लेस होना चाहिए by 2030. This is the aim. So finally, the aim is to achieve net zero emission by 2070. Of course, we are still far away from this particular plan, but at least we are trying. That is important from my side. Can we go to the next slide, please? Okay. So whatever the gas emission is coming, okay, this is the analysis by economic sector I have taken from that particular website. So electricity and production, okay, contribute 25% emission. Then agricultural, forestry and other land use around 24%, building 6%, transportation is 40%. So people are saying transportation is the major cause of CO2 emission. It's not like that. There are many other things. So even industry ranks first when compared with the transportation. Can we go to the next? So only transportation with the help of electric vehicle is not enough. Okay. So that is not the solution. That is not the solution. We need to minimize all the industry, agricultural, so on and so forth, everything. Okay, it's okay. We can go ahead. So that we'll manage the percentage of emission of carbon dioxide and we'll have the clean environment and it's again benefits to all of us. So what are the energy sources exist there? So if we focus on natural gas, again, it is a natural one. We can produce around 482 watt per meter square of the energy. Then coal, it is around 135.1. And if we focus on solar, which is free, I am repeating the same. that even though it is diluted, it is free. We have to do some arrangement and make it concentrated, and let's produce the energy, and it has a capacity to produce of solar of energy of 150 watt per meter square. Can we go to the next slide? Okay. So let's come to the actual points. This was general thing that I just shared with all of you, and let me explain one by one what are the research opportunities in nanotechnologies, and how the small scale is going to innovate a bigger thing or something bigger innovation that we'll discuss in let us say for more 35 minutes, and then we'll have a few discussion and then we'll end. So can we go to the next slide, sir? I'm sorry that you have to do this again and again. I am requesting again.
No, sir, no. It's the privilege.
Okay.
Please, sir.
So through this particular presentation, I will be talking on nanotechnology. Although many people are doing their research work, I'm not aware about your subject. Can you type into your chat box what is your subject, so that I will come to know what kind of area you belong and what kind of thing I should discuss with all of you. Although I am not that expert in all the areas of nanotechnology, I am working in the area of lithium-ion battery and supercapacitors, and I will discuss more in more details about lithium-ion battery and supercapacitor in my next session. The first is, first point is nanotechnology. Then we'll talk about fundamentals, then applications of nanotechnology. What are the research opportunities, and then lastly, the funding agencies, industrial collaboration, and yeah, definitely the global opportunities. Yes. Can we go to the next slide? Okay. So what is nanotechnology? Can we go to the next, please? Yeah. So let's start with some fun activity I have copied here. You can see the first left side competition, wrestlers competition. Competition between two wrestlers. They are of same size. We can say that they are of same weight. Let us imagine that it is a competition between micro versus micro. So we can't predict who is going to win this competition. We can't predict the winner. But if you see at the right side, micro, let us assume that the child is nano, and the one is the one at left side is the micro. So can you go to the next? So we can definitely judge here who will win. Yes, so definitely that what I am trying to say is that 240 kg, around 200 kg sumo is going to win at the right side. So nano is going to lose if it is single one. So can we go to the, so in the right side, we judge easily who is going to win, but in the left side, we are not going to judge who is going to win this particular competition. Next slide, please. Okay, so what we will do now, we'll balance the weight with the help of more number of child competitor. Okay, so what is happening next, please? So we can see here nano effect. When this particular sumo approach next, it is a possibility that nano wins, which is called as nano effect. Can you go to the next? So they togetherly can yes, move this. It is possible to have that the nano can win. So nano, okay, nano means it is having wonderful properties. Okay, not a single child can okay, overcome that particular 240 kg sumo, but a bunch of 20 kilogram children come and they can push the sumo. And that is because of the properties modulation in case of nanomaterials. We can say that. We should thank to the nano car which is there. Next, please. And because of this nano car, the problem of parking and problem of price is solved. So nano car and i20 car both can carry 4 people. There is no problem at all. So less power, but the thing is that the power is different. Horsepower is different. Less power. I think you are engineering people. You can understand better than me. Even you can explain better than me. But still, I'm trying to explain because I'm a chemist person. I'm not an engineer. Okay. Still, I'm trying to explain the things. So nano car is there. Less power. It has a less power, but carry same number of people, and price and parking issue is solved with the help of nano. When you compare the big vehicles, again in case of SIM card, So initial SIM, which was a standard SIM, it was coming with a case holder. And then nowadays only nano SIM is coming. Even we are saying nano word even to the car and even to the SIM card. They in reality they are not nano, because nano is something that we cannot see by our naked eyes. Yes, we have a human eye resolution limit. So size is reduced for better applications. I want to tell here that if size is going to reduce, we have a better applications, whatever the field. So it is concluded that as size has decreased, the applications are effective. Okay, next please. Okay, so what is nanotechnology? So once the word nano come, okay, there should be circulation in our brain. Okay, and that is why I have taken these kind of images over here. So nanotechnology is the ability to observe, measure, manipulate, and produce things at the nanometer scale, and that is called as nanotechnology. So what is nanometer? So we all know that 1 nanometer equal to 10 to the power 8 minus 8 meter. Okay, next please. Okay, so nature is connected to the nanotechnology, and or we can say that nature is giving idea of nanotechnology. Next please. So how nature is giving ideas to develop nanotechnology, that I'm going to explain in a couple of slides here. So if you talk about solar cell, it is expensive technology, we all know that. Okay, so what is the solution? So Professor Ghazzel talked about our research on dye sensitized solar cell. Next please. So dye sensitized solar cell. So we all know from class 6th that all the leaves are green because they contains chlorophyll and they are light sensitive. When light fall on a chlorophyll, okay, chlorophyll make carbon dioxide and water react to each other and it produces food, that is glucose and water. Yes, we all know that. Okay, CO2 plus yes, it is water, CO2 plus water to produce glucose. So chlorophyll is light sensitive, like semiconducting silicon is also light sensitive. So why not we can make some commercial or organic dyes that can absorb light, and that we can have a cheaper solar cell when compared with the silicon solar cell. And that was the solution from nature. So this is the thought came from nature, that chlorophyll is present in leaves. So why cannot we use we synthesize some organic dyes, okay, which are cheaper one, and they can absorb the light, and we can generate electrons and holes, and we can make a cell. So based on dye, and that is why that particular cell is called a dye sensitized solar cell. Next please. So the dye sensitized solar cell, it is very cheap, but its efficiency is very less, around 10% or 15%, not more than that. But now perovskite solar cells are there, in which the electrode materials are the combinations of inorganic and organic hybrid materials. So in the same molecule, inorganic moieties are also there, and organic structures are also present there. And because of that, what is happening? Perovskite solar cells, okay, they are working very good together, very better we can say, and efficiency is reached to around 30% to the best of my knowledge. Maybe more efficiency recent reports are there, but I have idea about 25 to 30% people have reported about the efficiency. So nature is giving nano ideas, and we have to observe the things that I explained in the first slide. So the scientists observe things more. They spend more time on observation, and they their thought process is filter, and again they try to develop a model. Just small simple ideas are required for research, not more than that. Can we go to the next slide? Okay. This is also the important paper. Okay, this is related to gecko. So micro fabricated adhesive mimicking gecko foot hair. What does it mean? There is one more image. Can you go to the next slide? Okay, there is a gecko image, and I have highlighted there the gecko feet. Okay, so that gecko feet is zoomed here in the second picture. Okay, and under microscope it is seen that it contains millions of thread-like structures, and that thread-like structures, when that reptile or gecko fastly travel on the glass or on the wall. We all know that. So gecko moves very fast, not only vertically but also horizontally in few seconds, several meters. So what is the reason behind that? So under microscope, it is observed that there are millions of layers. There are millions of layers, and that millions of layers, okay, when this paw is, is put on the glass window, there is a force of attraction called as van der Waals force of attraction. And because of van der Waals force of attraction, the gecko and all serpentines are fastly move. In few seconds, they travel several meters. So Professor Gaim, working at Manchester University, UK, you can see the micrograph image at the right side. They developed a paw of gecko mimicked, gecko mimicked in the laboratory, and this is the hanging toy of Spider-Man. Okay, so this is so interesting that with the nature is helping to create the gecko mimicked paw, okay, and which is useful to climb, maybe useful in the military application, to climb the somebody's house and like that. So climbing with artificial gloves is also kind of thing with the help of gecko feet is another application, we can say that. So if this image that is shown at the right side, it is the synthetic one. It is prepared in the laboratory by taking into the consideration of the millions layers that are vertically present on the gecko feet. I hope the point is clear. Can we go to the next slide? Again, the fish, that is shark. Okay, on the skin of a shark, there is a specific kind of structure you can see. This is a scanning electron micrograph of the yes, shark. And next, please. What this, because of this kind of the specific arrangement of the structure on the skin of a shark, it has a speed enhancing capacity. So speed enhancing technology is beneficial in transportation. Okay, so scientists are researching, developing such a polymer based materials have similar kind of structure, so that our vehicle should travel as fast as possible. Like aeroplane can travel, so we have to make a polymer coating on aeroplanes or vehicles, transportation vehicles, so that they can move faster. Or people are also mimicking this idea in clothing business. Swimsuits are there. If you have seen the swimming suits, okay, on swimming suits, this kind of pattern is there, so that the swimmer can go fastly into the water, like that. Again, the next thing is that butterfly. So the butterfly scanning electron scanning electron microscope, if you see, there is a particular arrangement. Next, please. There is a particular arrangement in the air gap is there. There is a particular arrangement of nanomaterial is there, and there is a gap, you can see a structured, well structured arrangement is there. So specific pattern is there, and that specific pattern imparts beautiful colors to the butterfly. So what is the advantage of this? So butterflies have evenly spaced layers of nanomaterials, biopolymer based materials are there, and they are separated by airs, and these are responsible for beautiful colors, we can say. Next, please. So self-cleaning hydrophobic surface exists on the body of that butterfly. So butterfly never loses color. It is always beautiful. So we, since our childhood, when we go to the garden, we try to hold that butterfly, and once we succeed, we definitely success तो नहीं मिलता है, but कभी-कभी मिलता है तो हाथ को लग जाता है थोड़ा color. Okay, so butterfly never loses color. Some color prints we get on our hands. Yes. So researchers are making, okay, they are trying to make dust-free windows with specific patterns, so that we can change the color of window time to time. आज green नहीं चाहिए, आज yellow color चाहिए, आज ये color combination चाहिए, so on and so forth. So people are working in this area. Okay. So let me talk about the history of nanotechnology. Okay. So what are the early origins? I will highlight here. So from ancient people were making these beautiful glasses with different colors. So there is a presence of gold and silver. I'm sorry.
Please unmute.
Okay. So people have feel the people don't know about the nano world at that time, but they know that if we do a material on small scale by cutting the material and feel that colloidal suspension in the water, okay, because of light effect, this gold nanoparticle shows different color. Okay, that was the initial things people were known, but the nanotechnology was not there in the picture. So if you ask me a question whether nanotechnology is new or old, definitely it is old. Okay, but the term nanotechnology is coined in around 1960, 65, something like that. So 20th century development, yes, it is written there. So idea of nanotechnology, okay, so it is given by Professor Richard Feynman, a physicist, okay, at Caltech, and yeah, he talked that there is a plenty of room at the bottom. So as how long you reduce the size, I mean, go to the lower dimension, just cut the molecule, cut the molecule, cut the molecule, the stage will come, you will never cut that particular molecule or atoms, you can say. And that particular thing is I mean वहां से बहुत सारे properties चालू होते हैं, and another things are going to happen, properties are modulating. Okay, so this is very important, and the message is that there is a plenty of room at the bottom. Yes, next please. Okay, so we have seen that this is gold bar. I have copied there, which is yellow in color. Okay, many people like gold, I know. Okay, but when you talk about gold nanoparticle, so the first image is spherical gold nanoparticle. Then the second image is rice-like or rod-shaped gold nanoparticle, and in the third image you can see the triangular-shaped gold nanoparticle. So this is the beauty of the nanotechnology, that we can play with the size, shape. Okay, and as size and shape is different, okay, the color of gold nanoparticle is going to be different, because electronic structure is also getting modified because of size. So you can see the red color gold, blue color gold, green color gold, black color gold, and at room temperature we know gold is yellow. Yes, next please. So based on size, I already discussed that, and shape, gold nanoparticles have different colors. Okay, so let's yeah, there are many people, there are many scientists, they're talking continuously about nanotechnology, but I have highlighted here a few important scientists. Out of that, Richard Feynman, I just told you that he said that in his talk, famous talk, there is plenty of room at the bottom. Okay, and he didn't use the term nanotechnology, but has described a process where scientists could manipulate and control on atoms and molecules, their shape and size and their color and their properties, we can say. So Dr. Norio, a Japanese scientist, coined the term nanotechnology as the processing of separation, consolidation, and deformation of materials by one atom or one molecule. Then Professor Eric Drexler is a visionary scientist and engineer. He is the founding father of nanotechnology. Then we cannot forget our professor, Indian scientist, Bharat Ratna Professor C.N.R. Rao is considered as the father of Indian nanotechnology. So nanotechnology, he gave a message that nanotechnology is not a single science. It can be, I mean, we can take a help of, I mean, it is applicable to chemistry, it is applicable to physics, it is applicable to material science, it is also applicable to engineering people. So as a chemist, I'm a chemist, but whenever it comes to fabricate a device, I always get scared. So at that time, I need a help of engineers. Okay, so how to synthesize novel material, how to I mean bring the novelty in the synthesis, how to do that particular synthesis as an original work, I'm expert in that. But when it comes to device, I'm a little bit afraid. So I have to take the help of physics people or engineer people. And you all are engineer, and definitely wait for you people to collaborate in future. Thank you. Next slide, please. Yes, this is a chronology of nanotechnology. Again, the same things are there. I will just read few things in that. And in 1986, the book Engines of Creation. Again in 2000, the National Nanotechnology Initiative is launched. In 2014, the first commercial nano biosensor was launched, and now in 2030 to present, okay, there is a continued exploration of nanotechnology's potential in addressing global problems, food security, climate changes, energy, so on and so forth. Next, please. So importance of nanotechnology. So I told you in my previous slide that we have different applications based on nanotechnology. We can have smart infrastructure, smart cities, biodiversity, waste management. We can do like water pollution, environment related problems. Then many things are there like internet, artificial intelligence, machine learning, etc. Can we go ahead? Okay, this is important slide. I want to give 1 or 2 minutes for this particular slide. You can see that we are using salt as a food in our daily life. Okay, so if you talk about salt, salt crystal, it is of some more size, like 100,000 nanometer. But if you talk about nanoparticle present in it, it is in between 1 to 100 nanometer. So the material which is having a dimension of in between 1 and 100 nanometer is called nanomaterial. So everyday usage of nanotechnology we are talking about. Okay, and then antimicrobial uses. So silver nanoparticles are playing the role. Okay, so you can see here that silver nanoparticles are effective effective in antimicrobial properties, we can say. Then the semiconducting materials such as zinc oxide, titanium dioxide, ZnO, TiO2, they are UV observers. I'm sorry, UV absorber. So these stuffs people are using in making sunscreen lotions. So nanotechnology is everywhere. So every day we are using nanotechnology. So cloths are there. So cloths, TiO2, again zinc oxide is there. Again silicon dioxide is also present, which is hydrophobic. Okay, so we can have less number of stains on the cloth. Again the sports equipment. So when you talk about badminton racket, so to hit a smash for a player like this, okay, it is from wrist, I know. So to hit a smash, the racket should be lighter. Okay, so people are using carbon nanotubes, carbon based materials to lighten the racket weight. Around 80 grams, 70 gram rackets are there. The cost is very high, around 3,000, 4,000. I mean normal. Okay, professional is again still expensive. So what is happening with doping of CNT, small amount of CNT, it increases the strength, what we can say, and decreases the weight. So sports equipment we can make with the help of nanotechnology, nanomaterials. Again, the quantum dots, light emitting diodes like zinc sulfide, cadmium, telluride, etc. people are using. So in day-to-day life, we are using nanotechnology, nanomaterials, we can say. Can we go to the next slide, please? Okay, so the fundamentals of nanotechnology. Yes. Yes, so I will briefly cover the size. If you focus on right side, there is a watermelon is of 10 centimeter. Again, go to the 5 rupees coin, which is few centimeter, not 10 centimeter. Again, coming to the left side, we have a ball pen pin, I mean ball pen point, okay, which is of a diameter of 1 millimeter. Again, going to the hair, okay, which is around 100 micrometer. So you can imagine nano that our single hair, nano is nothing but 10 to the power 6 times smaller than human hair, single human hair. Again to the virus, which is 1 micrometer. Again coming to the left, gold nanoparticle, I just discussed about it. And here comes the nanomaterials. So benzene is 0.5 nanometer, carbon nanometer is 5 nanometer diameter. So what is so special about nanometer? I mean, if any dimension is in nanometer, I mean, like graphene sheets, you heard about graphene sheets. Okay, I will come to that later. So graphene sheet is longer in micrometer, but its thickness is in nanometer. So even if one dimension is in nanometer, we call that particular material as a nanomaterial. So if we go from right to left, we can understand the nano scale or nanometer scale, how small nano is, we can imagine when compared with the watermelon. So from right to left, the size decreases, which is nano. Next, sir. Next, please. Okay, so imagine how nano small is. For that, this particular slide is there. This is very famous example given by many top speaker in their talk, and they have compared Earth, okay, with football. The football is 10 million times smaller when compared with the Earth. And fullerene, Buckminster fullerene, which is the allotrope of carbon, okay. C60 fullerene, C70 fullerene. There are many types of fullerene. Let us assume that it is a C60 fullerene. It means that sp2 hybridized carbon, 60 carbon atoms are there. They are club, similar to a football. 5-membered and 6-member rings are there, and its size is in nanometer. So when compared with the football, it is 1 billion times smaller. So it is 1 billion times smaller when compared with the football. So imagine how small it is when it is compared with the Earth. Okay, so this is a thing that is arranged here in order to compare or in order to understand the nanoscale. Next slide, please. Okay, so properties of nanomaterials. There are good electrical, good chemical, good optical, and good mechanical properties of nanomaterials. So let's talk about graphene. If we have a 52 cards, cat. We are playing cards. Okay, so 52 cards are placed on one another. They're not falling down. So they are attracted to each other. 52 cards are attracted to each other with the help of van der Waals force of attraction. Okay, so what do we have to do? We have to take one card. Okay, take one card, and it is free from the three-dimensional. This is graphite was three-dimensional, and this one card is two-dimensional. So this graphene, that single layer of graphite is called as graphene. So that graphene is highly conducting. Its mechanical strength, its chemical stability is very high when compared with graphite. So graphene is an allotrope of carbon, but its electrical conductivity, chemical stability, mechanical strength, optical properties are very high when compared to the graphite. So what I'm trying to tell all of you, graphite is a not nanomaterial, but graphene is a nanomaterial, which is a single card of 52 pages, okay, of cat, I'm saying. So how properties, which properties are enhancing? More specifically, mechanical, electrical, chemical, optical properties are enhanced in case of nanomaterials. Okay, there are again many materials: titanium dioxide, gold nanoparticles, carbon nanotubes. I'm not going into the details of that. The thing is that we have to understand that properties of nanomaterials are very good. They are better when compared with the bulk material or micron size material. Next, please. Okay, so what is so interesting about nanomaterials? So we have various kinds of nanomaterials with various dimensions, and all the dimension carbon-based material or metal oxide-based materials, okay, they are functional. What is the meaning of functional? I mean, they have engaged in many devices, say supercapacitor device, say lithium-ion battery device, say hydrogen production electrode, or as an electrocatalyst. There are many applications of each kind, each dimension of the material. So the beauty of carbon, more specifically, I'm talking about, is carbon is having it is a multi-dimensional personality, we can say. Like some people act in movie like Rishabh Shetty, he's a director, he's a writer, he's everything he did in Kantara. Like that, carbon is a functional material. So carbon is doing many jobs. Zero dimensional has different application. One dimensional, like when we focus on carbon nanotubes, it is one dimensional. There is diffusion of charges is very fast. We know diffusion. What is diffusion? Diffusion is nothing but the flow of charges from higher concentration to the lower concentration. So two dimensional is like graphene sheet. It is highly conducting. Okay, so in the foldable electronics, I told you that people will be using graphene as one of the standard or good material in case of foldable electronics. And then three-dimensional, we all know the pencil cell. As a chemist, I only know how to insert that particular cell in the watch, okay, or in the inside the remote control. We have two cells, AAA. I know that as a chemist, but you engineer people know how it is actually constructed. So construction is also one of the important things that, and we cannot avoid engineers. Okay, engineers mind, we can say that. So nanomaterials have various dimensions from 0 to 3 dimension, and these have different applications. So graphite is a 3 dimension. It is present in pencil cell. We all know that. It is also present in lithium-ion battery, which is present in our mobile or laptop. One of the material, that is anode material. So instead of anode or cathode, we can say just positive or negative electrode. One of the electrode is there, and it is a graphite. Okay, so graphite, graphene, carbon nanotube, fullerene, they have their own importance, own applications. On depending on dimensionality, they have different application and different we can say properties, and because of properties, they suits in different applications. Okay, next please. So what is happening with nano? Similar to that sumo image, sumo wrestling competition I have shown you. So this is the real meaning. So if you consider about the 1 centimeter by 1 centimeter cube, wait a minute. I have to charge my laptop. This is a problem of the charging devices. Okay. After a few months, yeah, it's going to decay its capacity. Okay, so cube is there 1 centimeter by 1 centimeter. Its surface area is very less, specific surface area is very less, and it is around 6 centimeters square. So if you go on dividing that cube, you can see the volume is constant, but the surface area is increased to the lot of extent. And because as surface area is increased, okay, nanomaterials have good result in energy generation, energy storage, catalytic properties. Many applications are there that depends on a high value of specific surface area. So why nanomaterials are important when compared to the bulk materials? Because of the fact that surface to volume ratio of nanoparticle is very high. Okay, because volume is same, but the hidden area which is present in between, we are going on cut that particular cube and we are exploring the hidden interior sites to the which are now reactive sites in case of supercapacitor as well as catalytic property. Okay, and that is why surface to area volume is very high in case of nanomaterials when compared to the bulk material. Okay, so that is why the properties are very or I can say the properties are found to be better in case of nanomaterials when compared to the bulk. Okay, next please. Okay, one of the important aspect of nanotechnology is synthesis methods. So how to synthesize a particular nanomaterial? So you can see at the midpoint nanoparticles are there. Either you can come from top to the nanoparticle, or either you can start with atomic level and come back to the nanoparticles. So top down methods and bottom up methods both are important. Both are having their own importance, own achievements, we can say. So we cannot avoid, or we cannot say top down is good and bottom is not that good. So both are equally important as far as synthesis of nanomaterial is considered. So I'm not going into the details of the methods, but I will slightly show what kind of top down and bottom up approach I have used during my research works. Next please. Okay, so this is the Scotch tape based exfoliation of graphene material. So the graphite piece is there, a very small piece, 1 centimeter by 1 centimeter, we can say. It is 3-dimensional. Still you can take you can imagine 1 centimeter by 1 centimeter piece, and the Scotch tape is there. So we can extract graphene layer from that particular Scotch tape. The example is shown there. So what is happening? Because I have told you 52 cards are there and one layer is a graphene. Okay, so chemically it is very difficult to prepare, synthesize single layer graphene. But with the help of Scotch tape, we can peel off a single layer of graphene, and which has tremendous properties in as far as conductivity, surface area. Surface area of graphite is around 30 meters square per gram. But in case of graphene, the theoretical surface area is around 2600 meters square per gram. So you can imagine how much time the properties are going to enhance. Okay, so that is adhesive step, which is called as Scotch tape. Okay, and with the help of Scotch tape, we can exfoliate a single layer graphene. So this is called as top down method. So the material is big, but we are getting nano. So we are coming down. So that is why it is called as top to down method. So Scotch tape approach of obtaining graphene is a top to bottom approach. Okay, next please. It is a top down method. So this is another approach, chemical method. Okay, and in this method also we are getting graphene. Okay, but by chemical method. So chemical, once there is a chemistry, I can see many chemistry people are there. As far as chemistry is considered, there are only 2 reactions. Okay, which are those reactions? The reactions are oxidation and reduction. Finish. Chemistry ends there. I want to explain this slide. Okay, how much time I have, Patil sir?
Hello sir.
How much time I have?
As per the schedule, it is almost completing.
Okay, I want 10 more. I want 10 more minutes. Just 10 more minutes. Okay.
No problem.
Sorry. Okay. So I first say sorry to all the participants and I will continue. Okay. So chemical method is also top down method, because we are using graphite powder and we are obtaining graphene. So you can say KMnO4 is there. Okay. And KMnO4, by using KMnO4, graphite oxide is prepared, and that graphite oxide is again reduced to graphene. So this is the process of just enhancing the distance between graphene layers. Okay, which are stacked on one another with the help of a van der Waals force of attraction. Once we do oxidation, the interlayer distance increases, and once we do the reduction, the oxygen is removed and the sheets are floating in the water as like this. Okay. So what we did in graphite, there is a strong van der Waals force of attraction, but after oxidation followed by reduction, the layers are separated. So again, we are obtaining graphene from graphite, and that is why it is also an example of top-down approach. Sir, please next slide. Okay, so what are the advantages of chemical methods? You can see in chemical method we have high yield, which is very cheaper method. Again, we can prepare various kind of nano composite, functionalize, we can achieve doping, and then we can do morphological modification. So what is the meaning of morphological modification? I will tell you. Just go ahead. Next, please. Yes, this is the top down. You can see graphite interlayer, this is stack, and in graphite oxide the layer distance is increased. Okay, and after reduction you can see the graphene sheets are there. So in graphite there are millions of graphene layers, but in graphene, which is synthesized chemically, there are around 50 to 40 graphene layers. So finally we succeed in separation of graphene layers. Graphene has a beautiful or excellent properties when compared with graphite. So the graphite image is shown at the left side. AB type of structure is there. Graphite oxide, oxygen containing functionalities are there at the peri as well as at the midpoint of the ring structure, you can say. And when you reduce, these oxygen containing groups are removed in the form of carbon dioxide, and we are getting only carbon sheets which are conducting. Okay, next slide please. Okay, so whatever the nanomaterial is synthesized, it can be characterized with the help of many instruments: the FESMT, 𝐕𝐢𝐜𝐴, XPS, FTIR, and XRD. Okay, I'm not going in the details. So applications of nanotechnology, just go ahead. So I already discussed these kind of application. Energy sector is there, defense section is there, agriculture, biotechnology, textile, in many field. Okay, many fields applications of nanotechnologies are there. It is difficult to cover in 10 minutes, so just go ahead. Okay, so I'll be focusing on energy storage, energy transmission, and energy conversion section in this talk, not in the detail, but roughly I will try to give the idea. Next please. So as told earlier, it is used in defense. Okay, CNTs. Okay, and CNT is flexible, graphene is flexible, so body armor, in that people are including carbon nanotubes. In weapon system also people are using the nanomaterials. Then medical application, just now the earlier session was based on the medical application of nanotechnology. So these kind of things are coming in defense because of nanotechnology. Okay, so nanotechnology in materials, we can have different application. Lightweight materials. Okay, aeroplane should be lighter because it has to travel 30,000 feet. Okay, and again very fast, so resistance should be as less as possible. So the material should be lighter, so it can be achieved with the help of nanotechnology. And then anti scratch and anti wear coatings. Okay, mobile screens, so on and so forth. Okay, so these things are really achieved with the help of nanotechnology. Then fire and heat resistant coats are there, so nanotechnology playing the role. And then advanced coatings are also there with the help of titanium dioxide, so self-cleaning glass, etc. These are the achievable things by the use of nanotechnology or implementation of nanotechnology, we can say. Next, sir. So there are many, again, nanoparticles. I already explained the use of zinc oxide, TiO2, nanosilica, carbon black, nano hydroxyapatite is also there. And yes, it is used to oral care. Okay, oral care, so on and so forth. So nano things are very important, and it has various applications. Next thing. Okay, so medicine, that is already discussed. I'm not going in the details of nanomedicine. Nanotechnology in medicine, I mean. Next, sir. Okay, yeah, this is very important slide. We can prepare a filter. Okay, we can place these filters over the chimneys, so that the gases will be absorbed by those particular filters, so that the air pollution will be less, and nanotechnology will play the role in that. Then nanomaterial improves the pollutant removal. Example, filtration is there. Then again, we can mix some nanomaterials like various iron based materials, so that it increases the it neutralizes the toxic chemicals. Neutralization is there, and enhances the fertility of soil. And again, we can control the waste. We can control the waste by using nano technology. So waste management, water treatment, air pollution, water pollution, soil treatment can be done with the help of nanotechnology. Next, sir. It is already discussed. Can we go to the next? Yes, agriculture also there are many application of nanotechnology. Next, please. Yeah, these are very important case studies I will highlight, and I will show two of my papers, and I will stop this session as it is already late. Okay, so cancer therapy. Sir, can we go to the back? Yes, thank you. So cancer therapy, gold nanoparticles are there. Then energy storage, graphene based commercial supercapacitor, Tesla company has already explored. And then environmental remediation, use of iron oxide nanoparticle is there to removal of heavy metals, pollutants from water. So a lot of research. So these are three case studies and impactful applications of nanotechnology, we can say. Can we go to the next? Next. Yes, so you can see the research opportunities of nanotechnology in the field of healthcare, in the field of environment, in the field of energy, in the field of electronics. So the number of papers, okay, from 2000 to 2019, remarkably increased, is around 189,000, okay, number of papers. So this is the graph that you can see the number of article growth from 2000 to 2019. Okay, so research opportunities are there in these areas. So challenges are also there in the field of nanotechnology, such as high cost is there, and then mechanism, how actually nano mechanism works, nobody knows, because below nano also scale is there, that is unexplored. So again the mechanism of properties enhancement is going to be different. So there are a lot of challenges you can say in nanotechnology, and yeah, definitely the things will be open in coming future. Next, please. Nanotechnology in AI, it is there. Next, please. Yeah, research opportunities in energy storage. So these are the energy storage devices you can see in the graph: supercapacitor, capacitor, batteries, and fuel cell. So what is important in these devices? In the devices, the parameters such as specific power and specific energy, these parameters should be as high as possible, and of course cost should be as less as possible. Okay, so battery is giving more energy, it doesn't mean that it should be expensive. We have to develop a battery in such a way that it should provide a greater energy, greater power, okay, but the cost should be as less as possible, and that is the main research in the field of energy storage. So all these are energy storage devices. I will tell the energy storage devices in my next session. Next, please. Next, please. I want to show my papers, that is it. Okay, so these are some of the papers published in the area of energy storage, and this is my green chemistry paper, which is highlighted here, and I will discuss about this paper in the next slide. Just a couple of minutes, not more than that. Okay, so this is the green chemistry paper. So whenever you do novel synthesis, you have to keep in mind that the method should be environmental friendly. वहीं पे तुम्हारा paper accept हो जाता है. So we are not the people that we are finding the solution. We are trying to find the solution. So in this paper, I just replaced the iron source. So when I was walking in front of my home in the year of 2008, I guess, so I found these binding wires, waste, जो construction में काम आता है ना, binding wire. So it was rusted. I collected that. I cut into the small pieces. I did some chemical experiment and I prepared Fe2O3 nanoparticle. So you can see the TM graph that वो chain जैसा बन गया है, जो गले में डालते हैं ना, chain, सोने का chain. So these particles are interconnected with each other, and these are Fe2O3 nanoparticles. I successfully prepared from the waste, and I gave the message that we can save the money. We can save the money on chemicals. So we can just collect the waste and we can prepare the Fe2O3 nanoparticles. So these are interconnected nanoparticles. So this terminology we have given, and because of they are interconnected, we got very good results in energy storage. Next, please. So you can see the device, this lithium-ion battery we prepared for that Fe2O3, and the results are very good. So we achieved around 1000 capacity. Okay, and this is the cycle life. 200 cycles are there. So 200 cycle means charge discharge, charge discharge, charge discharge. Like that, lithium-ion battery is present in our mobile. Okay. So I hope you are getting the point. So results are excellent. So what we gave a message? We gave a message that from waste material we prepared important nanomaterial, that is iron oxide, which is very simple idea, just observation. Okay, so what I'm trying to give a message, okay, we are not able to find all the solution, but we can at least try to find a solution, and because of that we will get definitely a paper like green chemistry. Next please. So I told you about the structure modification, morphology modification. So what we did here, go to the next slide. We have prepared graphene. So what is graphene? Graphene is like a plain paper. Okay, but we introduced the holes in a plain paper, small holes, which of different size, like hierarchical perforation. So if you see the downside G, H and I figure, you can see the holes in the graphene structure. ऐसा पेपर है, उसके ऊपर होल्स है, छोटे छोटे होल्स है, but the holes are of different size, and that is why we call that particular material as perforated graphene, hierarchically perforated graphene. And because of perforation there are n number of active sites, and we got excellent result in case of supercapacitor. So we published this paper first time. So I think our was the first paper, and we tried to introduce the perforation, chemical drilling in the graphene structure. And this material performed excellently in the field of supercapacitor. Next, please. Yes, hierarchical perforations. Next. So you can see the supercapacitor data. We achieved 350 farad per gram of capacitance, specific capacitance. When it is per gram, it is called a specific capacitance. So our perforated graphene and non-perforated graphene is at the downside, which is only 140 farad per gram. But perforated graphene perform around 350 farad per gram. So just a small idea of chemical drilling. Chemically, we introduced perforations in the graphene. Next, please. So now this is the paper. This is also interesting paper. In this paper, this is published in Journal of Material Chemistry A. What we did, we prepared apple-shaped carbon. So you can see apple at right side. And we have also prepared spherical-shaped carbon. Okay, and we conveyed a message that apple shape, and we introduced ordered perforation in that particular apple-shaped carbon. Next, please. Yes, here are the image. You can see left side is a spherical carbon and right side is a apple-shaped carbon. So on the periphery outside, there are ordered perforations of 12 nanometer, 7 nanometer, perfectly ordered perforation. And we with the help of electron beam, we cut the apple shape, that nano apple we can say, and you can observe the perforations are also present inside that apple. So not only perforations are present outside, but perforations are present inside the apple shaped carbon. And because of that, we got again excellent result in the supercapacitor. Next, please. I'm going to finish in couple of minutes. So you can see that the apple shaped carbon is pink one, and the spherical one is the red brown one. So apple shape is performed very perfectly in the field of supercapacitor. So we almost twofold energy and power related parameters we achieved in case of apple shaped carbon, just because of introduction of perforation, and shape is like apple shape. Next, please. Yes, next, please. Yes, these are some funding agencies, and you can always take a help. You can write a project, and you can have your good biodata with the help of publication. I always need a help of engineers. Okay. And definitely you can write to me on my email. You can contact me. I have given my contact details with Professor Avinash Patil sir. You can contact him, and you can take my number, and you can contact me anytime for any discussion. I am free. Next, please. Next, please. Yeah, these are some ethical things that you have to follow during the research. Yeah, data privacy is important. You cannot develop nanotechnology to hack the data. You cannot you cannot expose yourself to long term for nano materials, so on and so forth. So you have to be very careful. There are some ethical consideration in the field of nanotechnology research. Next, please. Yes, so there is a long term goal. Okay, in the case of lithium battery is well developed technology, but lithium source is depleting. So people are trying to focus on sodium battery and zinc ion battery, flexible electronics. Then nano robots are there. So you understand about nano robots. उरी मूवी में दिखाया है, वो गरुड़ पाकिस्तान में जाके yes, in Uri movie it takes the information of weapons, how many people are there. I am sorry, how many people are there, and grab the information with the help of nano kind of that Garud was big, but nowadays people are researching the nano ants, nano insects, so that they can cross the border and just grab the information, important information. So there is a long-term goal. We are not yet succeeded, but we are trying to succeed in the field of nanotechnology. Next, please. Yes, this is my research team. This is advanced AMRL. This is abbreviation of our research lab, that is Advanced Material Research Laboratory. Our research team is there. We are working on water splitting, energy storage, photocatalysis. Yeah, this is me, first Dr. Dattakumar Mamane, and my friend Dr. Mukund Mani. We are collaboratively working, and that is why we are producing fruitful papers, important data. We are original. We are doing original work, we can say. And these are my research students. And yeah, at last, I would like to say thank you for your patience, and special thanks to Avinash sir, Professor Avinash sir, for handling this complicated presentation. These are my research publications, and definitely I try to convey a message regarding nanotechnology. Of course, I cannot answer all the things, but I will definitely try to answer the questions related to energy sector, energy storage, so on and so forth. So nanotechnology has the potential to transform our world, proving that sometimes the smallest things make the biggest difference. This is the line by Richard Feynman, Professor Richard Feynman. So it is inspired by his visionary talk. That is, there is a plenty of room at the bottom. Next, please. So at the end, I definitely wish that you will have a good dinner. I know you all are tired, but thank you so much for giving this opportunity and having patience to listen me. I'm sorry for a bit faster at the end.
May I stop the presentation?
Yes, sir. Yes.
Okay, anybody is having any questions? If anybody wants to ask, very interactive session, very versatile session given by our resource person, Mamane sir. I hope all of you have taken all this variety of applications of nano material in the various fields. So anybody is interested to ask any question? So thank you very much, Mamane sir. The very interactive and very attractive slides through which you have presented your talk, and it will be very useful for all the participants. And we'll be having one more session of Mamane sir, I think on Friday. So we will enjoy one more the energy applications in detail, I think. Is it, sir?
Yes, sir. Yeah. More specifically, carbon and oxide-based materials for energy storage applications.
Yes, yes, yes.
Supercapacitor, their mechanism, lithium-ion battery, and their mechanism. That is it. Not more than that.
Yes.
But I think I'm not receiving questions. It means that it has two meaning. Either they understood everything or didn't understood.
Yes,
They understood nothing like that. Okay.
Yes, yes, yes. No problem, sir.
Okay.
I think it's
Yes,
late
it is
now.
too late. Yeah.
Yeah. So I sincerely thanks once again.
Yes, thank you. Thank you, everybody.
For this wonderful session. And I appeal all the participants. The feedback link is posted in the chat box. So all of you are requested to give your feedback of both the sessions of today's.
Yes, sir. And I would like to say sorry, because initially we lost our 5 to 10 minutes in arranging that PPT.
No problem, everybody. Sir. No problem. It's the usual things during the online sessions. Some difficulties used to come. We have enjoyed your PPTs and very versatile applications of nanomaterials.
Thank you, sir.
Thank you very much, sir. And once again, I thank all the participants for attending the session, and I appeal and patient listening. And also I appeal all the participants to give your feedback. The feedback link is shared in the chat box, and we will meet again tomorrow for the third session at 6 p.m. sharp. And remember, the attendance for all the sessions, your 80% attendance for all the sessions is very essential to get the certificate. So I appeal all of you to join in time before 10 minutes of tomorrow's session. Thank you. Thank you very much. Thank you, Momane sir, once again.
Yes,
Shall
shall I
we close the
leave?
meeting, sir?
Shall I leave?
So shall we close meeting?
Okay. Thank you, sir.
Yeah.
Good night, everybody. Good night.
Yes, sir. Thank you. Thank you very much. Thank you all the participants. Good night. Stop.